your trustable clients for you. So that way it helps you not only for documentation but gaining your medical practice. So with that introduction, I'll just go into the basics of it. So what is iridology? Basically, iridology is a science and practice that reveals a body constitution, inherent weakness, levels of the health and transition that takes place in a person's body according to the way he lives, and is an alternative diagnostic technique. So is it a complete only diagnostic? No, we are taking it as an alternative, supportive diagnostics to other procedures what we have. It reveals changes, inflammation in the body, location, and in what stage it is manifesting. It does not compare all people together to create a normal. See, that is a fundamental difference in facial diagnosis, or iridiagnosis, or in naturopathy principle. We never take as a group. See, in allopathy what happens, we take it as one standard. Anyone who has the sugar levels of above 120 fasting is considered diabetic. But in naturopathy, do we talk anywhere like that? No, we don't have that process at all. Unless there's an effect, it is individualized always. For this person, this problem is making him to suffer. And once that is resolved, he is normal. That's all. But it is not in a group where we compare. So weak organ in a strong body produces different characteristics. It is a weakness for the person. Iridology has nothing to do with the traditional medical concept of pathology, but studies the reactions of a person in relation to their genetics. So observation of the iris fundamentally subject to the interpretation of the observer. So basically, unless you have the knowledge and how you interpret, based on that only iridology works. The iris is subject to the interpretation of the reflexive signs that are observed. The signs are not a part of the pathology, but they allow us to deduce, for example, the strength or vulnerability of the organ systems, variations of functions, and predispositions. Iridology let us redirect our lives in terms of personal, dietary, or physical behaviors, and if we feel ill, it lets us identify the most effective natural therapy for us. So iridology is a non-invasive form of analysis, meaning it requires no cutting or x-rays or any other invasive technique to conduct the health analysis of an individual. So no body fluids, no saliva, no blood, or nothing is required. Basically, it's just an observation. You are looking into the eyes and instantly you are able to talk out about the diagnosis. So basically how the eye develops, if you want me, the eye begins to develop as a pair of optic vesicles on each side of the forebrain at the end of the first month of pregnancy. Eye tells us about the brain unlike any other part of the body that is visible. Healthy eyes indicate a healthy brain. There is a connection between the eye, the brain, and the nervous system. The optic chiasm is an X-shaped space just in front of the pituitary gland where the optic nerve fibers pass through to the brain. The fibers from the nasal half of each retina cross over, but those from the temporal sides do not. The nerve fibers then continue to the optic tracts. In the brain, the right hemisphere controls the left side and the left hemisphere controls the right side. So the different layers. All of you must have done your record books at least, where you put about the anatomy of the iris and all that, right? So it's a recollection of that a little. So the outermost layers, the conjunctiva, the sclera, and the cornea. Then the middle layer consists of the choroid and the ciliary body. Okay, and finally the innermost layer, the retina. Right? All of you are familiar with this. So I'm not going into the depth of it. Basically the rods and cones which differentiate between the light and the darker this thing. The cross section of the iris, the various layers of it. And the muscles which dilate and contract the iris. Okay. So again the vascular layers, basically only the anterior border where the color and pigmentation of the layer is brought. That is what is important in iridology. The rest are basically for purpose of this thing. So coming to history, Asians have used the iris and sclera for thousands of years to interpret health. So we know or we talk about in naturopathy completely the Western concept of iridology alone. But in Ayurveda, naturopathy for thousands of years, there was facial diagnosis, there was pulse diagnosis, and iridiagnosis always present. Only with that observation, only any doctor used to move forward. But we lost that science. That's the reason whatever history we are taking it, we refer generally from the European perspective only. So Chinese from the ancient times studied the eyelids, whites of the eye, pupil and iris, just as they study the tongue and the head. So how this has happened in China? How many of you have seen the 7th and what is that? Pardon? Seventh Sense, right? Seventh Sense movie, right? So that's a real story. When I was doing my acupuncture course in China, even now there are a lot of temples which are constructed for, what's his name? Bodhidharma, right? They revere him with utmost respect, and they say all the martial arts, acupuncture, all the diagnostic techniques, and as well as the herbology or the traditional Chinese medicine, what they call, is all from India. And first time when I went there, just like a big university, Nanjing International University of Acupuncture, which consists of 28 departments. Each department has 20 to 30 doctors. Okay, all the departmental heads, 3 of us went actually. So we were in an auditorium like this. We were just asked to come and sit in that auditorium. I didn't know. I thought someone else is coming. We were just attending a conference or some meeting along with other doctors. All the departmental heads came and bowed to us. I was surprised. Why? Where was the acupuncture started? Our textbook says in China. It's a system of Chinese medicine. That's what my textbook used to say, or naturopathy. That's how I was taught. They came and said, acupuncture was taught to us by Indian monks. Until that time, we were absolute nomads. We didn't know about any diagnosis or therapy. I was shocked. How come I never knew this? Because I finished my medication, BNYS, and I had practiced almost for 10 years before I went to China. And never I knew acupuncture was from India, till I went there. So same way, iridognosis is basically from the same Indian systems, which was also taken over. All the, now they're so advanced, they have professional cameras, they have entire software, they have recording, comparison, this thing, online consultations they do based on iridognosis. Okay. In ancient Greece, Hippocrates, the father of medicine, stated, behold the eyes and behold the body. Certainly this reinforces the biblical idea of the eye being the light of the body, the window into our inner world. So European founders, this is a very interesting story all of you must have heard about. What is that? When a leg was broken, immediately he saw a streak in the owl side. That's why they say the iridognosis is started, right? Then there are various other European founders, and then in the Australia also iridognosis became quite researched, and a lot of papers have been found, and of late US founders are also there who started publishing various books. So right now whatever books we have are all only from these people. So what does iridology reveal at all? First of all, the constitutional strengths and weaknesses, inherited strengths and weaknesses, general health levels, nutritional chemical needs of a body, location of toxins inside the body, dietary needs and problems, the quality of the nervous system and the internal organs, acid levels in the body, the response of a client to a treatment. Iridology is also unique in that it can reveal the body as a whole without many different tests. When you look at the eye of a person, you are looking at their entire body at once. So that's something which we have to remember. It's not differentiating a symptom or organ wise. It's the whole body which we are looking at. Where inflammation is located inside the body, underactivity or sluggishness of the bowel, including spastic or balloon conditions, what organ is in the greatest need of repair, inherently weak organs, glands and tissues, and constitutional strengths or weaknesses. Hyperactivity or hypoactivity of organs, glands or tissues, buildup of toxic material before the manifestation of a disease. So actually we can say much more earlier than the disease cropping up and actually the patient complaining that I am suffering with this, you can say and warn them that this is what is going to happen, you may have this problem in future, so start taking care. That's where iridognosis is very, very helpful. Prolapse of the transverse colon, lymphatic congestion, healing signs indicating an increase of strength in an organ, gland or tissue, and sources of infection. Whether a particular program or a therapy is working or not, that means whether any procedure, treatment, what you are giving is in the right direction, helping the person to recoup or not, also we can observe. The overall health level to the body as a unified structure, high risk tissues, areas in the body that may be leading to a disease, the primary nutritional needs or deficiencies, and this is what is very important. Okay, what all it can reveal is very important. Now the moment we say I can start diagnosis looking at your eye, what are the expectations? They think it is a magical wand, they want to come and test you. What all we can't say also, we should be very clear. So identify what medication or drugs an individual is using or has used. They come and say, okay, look at me and tell me what medication I'm taking. Can you do it? No, you can't. Okay. Determine what operations a person had. So someone must have had a gallbladder removed. He comes and says, look at me and tell me whether I have a gallbladder or not. You can't. Okay, that all those things you can't do. So it's not a magic or not a shortcut for something. Identify disease by name. Tell what foods a person eats. Determine the number or organs when a person has been born with. Example, one kidney or a double. Instead of having two kidneys, someone was born congenitally with a defect, having only one kidney. But doesn't mean you will be able to identify it. Okay. Determine whether a woman is pregnant or not. This is one more very important thing you should remember. Whereas in pulse diagnosis, they say, you can identify and say a woman is pregnant, but in diagnosis you can't. Show whether gallstones or kidney stones are present. Identify sexually transmitted diseases. Tell whether a person is a male or a female. Indicate whether an operation may be necessary or not required. Correlate tissue inflammation levels with a certain disease or symptoms of disease. Okay, so that's a list of things which you can't identify or you will not be able to reveal. That much you should be very clear about. But how does all this work, first of all? The iris of the eye is the most complex tissue of the body meeting the outside world. It is an extension of the brain, being incredibly endowed with hundreds of thousands of nerve endings, microscopic blood vessels, muscles and other tissue. Iris is connected to every organ and tissue of the body via the brain through the optic nerve and the central nervous system. The nerve fibers receive their impulses by the way of their connections to the optic nerve, optic thalami and spinal cord, which are formed embryologically from the mesoderm and the neuroectoderm tissues. Nerve pathways all over the body continuously send information to the brain via the thalamus and the hypothalamus. So these two parts of the brain are the monitors for all ongoing vital activities in your body and are connected to the blood vessels and muscles and surface of the iris by nerve fibers. So the physiological changes develop in the iris tissue when the nerve impulses are relayed from the thalamus and hypothalamus via the optic nerve, revealing information from the various parts of the body. So those are software or messages which are sent and imprinted onto the iris. Our iris starts reflecting all those signals. As we grow older, changes in your health are reflected in our eyes. These may appear as the clouds or marks or discoloration in your iris, which will go further and dwell. By studying and identifying these changes, you can detect health imbalances early and preventive health measures can be recommended. In this way, nature has provided us with a miniature television screen showing the most remote portions of the body by way of a nerve reflex responses. So eye not only enable us to bring the images of the outside world within, it also shows the images of what is within to the outside. Nerve fibers in the iris respond to changes in the body tissue by manifesting a reflex physiology that corresponds to specific tissue changes and locations. The iris reveals an individual strength and weaknesses and what has been done to the body through incorrect living habits. It also reveals the wonder of one who has lived a good life according to the laws of the universe. So the use of iridology will interpret signs in the iris by studying pigmentation or pattern changes. Pigmentation changes correspond to the stages of inflammation in the body. So the three stages basically, which again you must have recorded, talking about acute stage, subacute stage, chronic or degenerative changes which have happened. So how was the iris chart discovered or brought in over a period of time? So over years, careful observations in clinical environment have allowed us to unravel the mysterious languages of the iris. Today we have a map of the iris topography which guides us very accurately over its surface. In this way, it is possible to read the tissue condition that relate to the whole person being viewed. We are seeing the whole body at once. So the chart developed by Dr. Bernard Jensen is the fruit of 50 years of research and intense study. Each organ is identified and those of major importance are outlined so that they are easily located. The chart represents the arrangement of the iris into its corresponding locations as found in a normally organized body. So I'll make it very easy for you how to remember basically an iridology chart and start observing. All the different parts of the body represented on the iris chart are laid out in a sequence as they are inside a body. Both the left iris and the right iris have their own charts. The left iris represents the left side of the body and the right iris represents everything going on the right side of the body. Why we have do different? The reason it is considered that they are separate charts is because both the left and the right iris charts are mirror opposites of each other. So they are not exactly the same, they are mirror opposite, mirror view of each other. For example, in the left iris, the lung is located at the 3 o'clock. Here, at 3 o'clock position, lung is located in the left iris. Whereas coming to the right iris, you see it exactly at the 9 o'clock instead of the 3 o'clock. So that's how they are the mirror opposites of each other. For the purpose of this presentation, let us look at the positions of the left iris chart. So instead of comparing both, I'll just go with the left iris so that you can imagine the same as a mirror opposite on the right side. Picture the iris as a clock. It is compartmentalized into 30-degree increments or every 5 minutes, right? Any clock would be 30 degree this thing or a 5-minute interval. Like this. Okay. From 12 o'clock, the brain is represented. Brain being the highest point of the body, both the areas positioned from 11 to 12 and 12 to 1. That means 60 degrees almost there, basically. 30, yeah. Are where the different parts of the brain can be detailed. Both the physiology and the psychology of the brain are represented on the top side from 11 to 1 area. Okay. Remember what is in the left iris is mirrored in the right, again just repeating it. So from 1 o'clock until 2, so from 1 o'clock to 2 o'clock, neck area including the ear and the shoulder are represented. So it's just suppose you remember always the standing like this from head to the leg. So continuously you are coming down. So topmost brain, then the neck area including the ear and the shoulder. Then from 2 o'clock until 3, the left lung and the heart. So from 2 to 3, the lung and the heart are represented. So again in the mid area. So from 3 o'clock until 4, the thorax are represented. At 4 o'clock, the arm and hand can be found. So this portion we are completing by 4 o'clock. From 4 until 5, the upper abdomen is detailed. This includes the spleen, diaphragm among the other organs. From 5 to 6, the lower abdomen is located including the pelvis and the groin area, 5 to 6 area. At 6 o'clock, we have the hip, the thigh, the knee, the foot are represented. Hip, thigh, knee and foot at 6 o'clock. So just imagine head here, foot down there. So all on one side, coming from top to down. Then from 6 to, again, at 6 o'clock, notice that how they are detailed in order. From 6 to 7, the kidney and adrenal glands can be found. So now think you are going backward. From front side you are finished, coming to the back side of the body from the trunk. 6 o'clock to 7, the kidney and the adrenal gland can be found. From 7 to 8 until 9, both the lower and upper back are located. So this is where basically your spine and other areas are located here. From 9 until 10, the throat is represented here, and the thyroid gland also, and parathyroid. From 10 to 11, everything on the face is detailed. Here, this becomes your facial area. Okay. So notice the organs in the right iris are mirror opposite compared to the left. So the biggest difference being that the heart can be only examined from the left iris. So you find heart here in the left iris, whereas on the right side you will not have heart because heart is present in the left side of the body. Similarly, liver can be examined only on the right iris. Liver you can find it only in the right iris here, whereas here there is no liver represented fully. That's okay, only a small area we can see, and that comes only by experience. Otherwise, it's mainly on the right iris only you will be able to find it. Then coming to the radial zones. So how do you remember it? Making it very simple. Basically, always remember 3 quadrants. What are they? The cephalic or the reflexive zone, which is the top side of the body, the head and the upper side. So that comes from 11 to which area? 3 o'clock or this portion. So 11 to 1 o'clock, sorry, not 3, 11 to 1. This is the cephalic area. So then the thoracic area is from 1 to 5. Okay, and The abdominal and the pelvic reflexive zone is from here to here. So basically 3 zones, if you remember, it becomes very easy to fill up all those zones. Okay. Then what are the other charts? Basically you compare every chart, it's almost similar with some minor variation. So based on their experiences, based on their observation, various charts were prepared. But most of it we can very easy to follow and generally taught in all the colleges, I think, is the Dr. Bernard Shaw's this thing. So this is by Dr. O'Brien, Peckley's chart. I mean, just for giving an example, I'm just showing this charts. So there are a lot of charts available. You can pick up whichever chart is easy for you to remember and follow. Always have one printout on your table or along with you in your book, so that whenever you go to a patient, you can observe and immediately refer to it, so that becomes easier. Then the topography of the iris by major and minor zones. What are they? The pupillary border. This reddish orange to brown circle around the pupil is where the iris edges meet the pupil and offers insight into the spine. So this area where iris and pupil meet, that border is where it represents the spine. It is where we view the central nervous system of the iris. This border is referred to the inner pupillary rough, an extension of the optic nerve. Its appearance, either thick or thin or broken, indicates the condition of the central nervous system. Then the collarity. The collarity is a major marker in the iris, about 1/3 way to the outer rim or limbus of the iris, outlining the intestinal area or interstitial area. It is also known as the autonomic nerve breadth, as it reflects the autonomic nervous system. Where it extends or contracts, points to a possible imbalance in that section of the iris. Okay, so this is the area basically, which is called a collarity. Then the pupillary or the nutritory zone. This is the area between the pupillary border and the collarity. The stomach and the intestines are reflected here. When the sphincter muscle is visible, it looks like a white or light circle around the pupil and indicates acidity or hyperacidity or hyperactivity. If it is heavily pigmented or overlaid with color, it indicates toxicity and underactivity. Then the last layer, the inner, mid and outer ciliary zones, the area of the iris outside the collarity. So basically 3 zones you have to remember. And then the concentric 7 zones. While the iris chart is used to detail and analyze the organs and tissues of the body broken into 30-degree increments, as you would see in a clock, the iris can also be mapped into 7 concentric zones. These zones can quickly locate the different systems of the body, its vital organs and glands starting from the pupil. Working outward, divide the iris into 7 circular zones. This concentric circular zone chart is a sort of quick guide to locating the different areas of the body before delving deeper into an analysis. So what are they? The zone 1, nearest to the pupil, stomach can be found. Zone 2, intestines are located. Zone 3, heart, bronchi, pancreas, adrenals, pituitary, pineal gland and the gallbladder are located. Zone 4, the skeletal system. Zone 5, brain, lungs, liver, spleen, kidneys and thyroid. Zone 6, circulatory system, lymphatic system, muscles and the motor nerves. And finally zone 7 is where basically the skin is located. That's how, if you can remember, and then there's the 3 zones, if you can remember, cephalic, thoracic and the lower interstitial, it becomes very easy for you to remember those areas. Then how do you differentiate? I mean, if you see only a photograph sent by someone, how do you differentiate between a left and a right iris? So the pupil favors the nose. When trying to determine if a photo is of the left or a right iris, the pupil will be closer to the nasal or the medial side a little than the lateral side. So that's how you'll be able to differentiate between a left eye photo and a right eye photo. The shades of the color. Shading indicates vital force or the body's ability to react to illness. So when it is light, more reactivity, inflammation or elimination or in pain. Dark, suppressed body cannot react it sufficiently. And gray fibers, relaxed and indicate weakness in the organ, gland or tissue, but not as severe as dark. And reactive, contrast between the light and the dark. So, iris reading. The first thing an iridologist will look for when reading the person's iris is to determine what type of constitution they have. The person can either have a strong constitution or a weaker constitution. Having a strong constitution is indication that a person can bounce back from an illness or fight of an illness much quicker than a person with a weaker constitution. A person with a weak constitution may take a longer time recuperating from an illness. So, density of the fibers. Structures compromising the stroma and surface layer of the iris are normally developed and arranged in an orderly manner so that lay in a smooth, even layers like the fibers in a perfectly woven fabric. So, basically you can see dense, mildly dense or loose way how the fibers are arranged inside the iris. So, density is a measure of that which we call vitality, tone, power of resistance or recuperative power. So, just like how fibers are arranged in a fabric, you can differentiate between the constitution of the iris or the person. People with tight, close fibers in this iris structure represent strength and more resiliency. The looser weave shows less resistance and a slower recovery. Okay. Then these are a few of these things. A person with strong constitution, tightly woven fibers as they radiate around the pupil, a sign of inherited strength from the parents and grandparents. So, average constitution, medium weave in looseness of the fibers, most will have average fiber constitution. Then a poor constitution, very loose fibers as if comparing the weaves of silk to a burlap. This is burlap. Then the eye colors. Overall eye color is dependent upon the quantity of melanin pigment present. So, dark brown, which all of us Asians generally have, or Indians what we normally come across is all dark brown eyes, right. So, dark brown eyes are heavily pigmented, obscuring underlying iris fibers, whereas most of the Europeans have light brown to complete blue eyes like this. So, where it is much more easier to penetrate and see in deeper tissue also, where you will be able to very easily differentiate. So, light brown eyes have less melanin with off-white or yellowish appearing stroma. In blue eyes, there is only a small quantity of scattered melanin granules which reflect the light. So, blue iris, typically a blue eye types have lymphatic congestion which involves excess mucus. Health problems usually start with colds and sinus troubles, move into the ear, throat and lung problems and wind up with kidney and joint disturbances. Whereas in mixed eyes, sometimes referred to as biliary type, these individuals should pay special attention to digestive system, stomach, pancreas, gallbladder and especially the liver as well as the interstitial tract. So, then the brown iris typically prone to imbalances in blood composition and should pay special attention to the circulatory system, the heart, blood vessels as well as the organs that make up blood, the liver, spleen and the bone marrow and the digestive and endocrine systems. Now, just based on this, see, just to give you a break from the continuous reading what I am doing. What color do we have, Indians? Dark brown to brown eyes. So, what does this say? Brown iris people genetically are going to have circulatory problems and digestive issues. That is what this says. So, now what are the capital of? Diabetes and hypertension. See, brown iris, that is where you can correlate immediately. So, this is a proper science. It is not just something which you have to read and just forget, or just put diagrams or ask someone to draw, your juniors to draw records and submit it for you. Okay. If you can just go and start understanding every word what they have mentioned and written, documented, makes some sense when you start observing. So, that is what is very, very important. Whereas, when Europeans come, it is more of a different with phlegm formation and other things. They are very sensitive for their eating habits. They can't tolerate spice, because even a normal spice which we normally say it is very less spicy, it is very hot for them, because their digestive systems are weaker. It is not just the habituation, it is by genetic nature there is a difference. So interpretation of different colors in the iris which occasionally appear as some pigmentation, as some dots inside the eye. Colors in the iris play an important role in understanding a person's health. In addition to three constitutional types of blue, brown and mixed color in the iris, colors also have an impact. These added colors in the eye might come from exposure to toxins in the air, food, water, or inherited sometimes, very rarely. So what does those colors indicate? If there's an yellow spot or this thing, suggests poor kidney function. Okay, again, okay, gray, hypoactive metabolism in areas such as in the stomach or digestive area. Orange indicates difficulties in metabolizing carbohydrates, starches and sugars, and suggests weakness in the liver and pancreas. Fluorescent orange, primarily gallbladder, possible pancreas and liver issues. Brown indicates poor liver function and sluggish and toxic blood. Black, a condition of long standing or chronic issues inside that area. Okay. Then lesions, lacunae and crypts. So lesions, lacunae and crypt are the iris signs that lower constitutional value. These signs appear as holes in the iris tissue. Depending on what stage these holes are progressed will determine if they are either lesions, lacunae or crypts. So this is an example of a lesion. See, suppose now we have a lesions here. This is an open lesion. See how one end is opened up here, this is open, not closed, whereas this is closed here. This is a closed lesion, encapsulated, right? This is an example of lesion. See how one end is opened up while the other end is closed. Having one side open is an indication to the iridologist that this tissue is active, in that nutrients, circulation and metabolic function are still flowing through the tissue, be it at a reduced rate. This will give the person having their iris examined the knowledge to know that preventive measures can be taken so that he can improve back. Then the term lacunae is used to describe a lesion that is closed at both ends. This means that the tissue has been encapsulated. This is a clear indication that no nutrients are reaching that part of the body with proper nutrition. These effects can be reversed. That takes a little longer time for the reversal to happen. And the patient has to really work for it. It's not just 1 day, 2 day fasting or something which is going to help. Unless he takes care and starts working for more than a month like that, that area can be reversed back. Then few iris signs and terms. You all must have drawn the charts, various this thing. A few of that, I'm just showing it here. Fibers that are less dense, showing that particular area needs an extra care, more supportive treatments. At 6 o'clock in this photo, the darker shading compared to the topper area, this is a darker area, right? The darker shading is actually the view of the posterior epithelium. So coming back, the lacunae, these are gaps of variety of shapes and called lesions. The closed lacunae looks like a football or a capsule which is closed on both ends. It is believed that these areas are hard to penetrate when a problem arises in them. Open lacuna, open at one or both ends, at one lines do not meet. It indicates that the nutrition healing are still penetrating the area. The same repetition slide. The crypts, very dark, small lacunae, usually diamond shaped and right along the collarity. These are an indication of a chronic condition. Often we will find a white line around the outside of these markings indicating scar tissue has formed, fortifying the encapsulation. Where they are located along the bowel indicates a family history of issues such as diverticulitis, etc. If located right along the pupil border, some consider them as a sign of leaky gut syndrome. Then radial fibers, or trabeculae they are called. These are normal iris fibers made up of blood vessels that are collectively called a stroma layer. The iris consists mainly of these fibers. The stroma connects to a sphincter muscle and the dilator muscle. Then the transversals, instead of the longitudinal ones, there are some transversal fibers also. These fibers appear to have fallen and run tangential to the stroma fibers. They travel across the brain of the regular fibers. The lighter or whiter they are, the more tendency for pain and irritation. Then various shapes of this lacunae. So instead of just being a diagonal or some particular shape, you can have various shapes also. A breaker opening in the quality which shows weakened nerve energy to the area it opens into. Look to the reaction field and the bowel, as there may be a toxic bowel condition relating to the physical field where the break occurs. Then the contraction furrows. What are these are also called? Stress rings or the nerve rings. Okay. Circular pattern that cuts across the direction of the normal fibers. So instead of the normal fibers, these are circular fibers which are crossing across it like this. So it appears as rings, known as nerve rings as stress rings. Then the lymphatic rosary, a string of cottony appearing puffs that indicate a heavy lymphatic system congestion. The lymphatic system is a major elimination system in the body. Then the scurf ring. Scurf ring is a darkened circle around the edge of the iris in zone 7. So completely on the outer side, a darkened ring kind of a structure. Where the skin is found, it can be in parts or it can circle the iris entirely. A scurf ring is an indication that skin is under active and slowly eliminating toxins. This happens when toxic materials build up in the skin, such as solvents, fixative paints, fertilizers, pollutants, and other air and waterborne chemicals. Then bowel pockets. A little pocket or indentation in the side of the intestine. So from the normal smooth flow, you can see small dent kind of a pockets here. Intestine where the waste materials can accumulate. Autonomic nerve root represent, this is a autonomic nerve root, the edge, basically the border, indicates the autonomic nervous system. Then overacid stomach. When light colored ring of the discoloration is located just outside the pupil, it indicates that the stomach is overactive or has too much of a acid. When dark, it shows the stomach is underactive or lacks HCl. So basically if this is light, it says it is hyperactive or acidic, and when it is dark, it says less acid or underactive stomach. Then radii solaris. Rays of the sun are basically radial spikes, signs of toxins seeping from one area to the next within the body. Or it also says slow moving bowels allowing for toxins to be reabsorbed into the blood system. Possible parasitic infestation, most often seen in Candida albicans overgrowth. So radii solaris indicate that this individual needs to cleanse and detoxify his bowel and body. So whenever you come across this, basically you have to suggest them to go for fasting and cleansing up, or detoxification is required. Then impaired circulation represents compromised circulation in the brain and other extremities. It can appear as a crescent in the upper portion or sometimes in the lower portion or both sides also. Then impaired circulation, the arc of old age, that is arcus senilis. So on the top brain area, you see this whitening of this thing. So that means the brain is slowing down or aging up. Crescent shaped sign, the brain areas, and indicates a compromised circulation to the brain. Then the circulatory rings, also known as venous insufficiency, it indicates weak circulation. It looks like a blue ring outside the skin zone area in the sclera. Am I going too fast or just going out? Because time is short and just brushing up it up, okay? Then central heterochromia, a different, usually darker color pigment concentrated in and around the nutritive zone. The central heterochromia indicates possible elimination problem, gas, liver and gallbladder issues. So sectoral, instead of being the whole area, this is sectoral, only one particular area has a, deposits. Then hypertrophic heterophyia is lighter or with less pigment than the rest of the iris. Then this is one more very important thing, very rarely you can come across in the textbooks. If you can just understand and remember this, it becomes very easy in many observations. The size and shape of the pupil can indicate spinal subluxations. So you said you wanted something with manipulation techniques. So that's where the subluxations come into the picture. Just observing the iris, subluxations can be found out. but also signs of stroke and a brain injury. So pupil tonus relates to flattened or deformed sections of mostly circular pupil. The direct relationship to the cerebral spinal fluid has been confirmed through research. Pupil flattening and irregularities in the eye can eventually go back to the normal shape with proper therapy. So before and after correction, manipulative techniques, if the subluxation is properly corrected, you can immediately see a difference in the pupil. I mean, of course, that comes with a lot of practice and this thing, but I'm just telling you. A flattening of the pupil shape indicates a disturbance in the adjacent iris area. The stronger the disturbance, the flatter the pupil in that area would become. So total deformation, total is when the pupil takes an oval shape, total ellipsis, indicating the nerves are not properly supplying the muscles for contraction. Here there is a pressure or swelling from the brain and the spinal cord. This can be a serious condition. Partial deformation, these are flattening of various types which correspond to the organ and tissue adjacent to the flatter areas, which we will see. So the frontal flatness. So on the top side, frontal flatness areas at the top of the pupil point to the brain, pituitary, pineal and transverse colon. So possible is depression. So by just observing, whenever you see a tonus, that means instead of being round, if there is a flattening on the top, you can immediately ask the person whether he is under any depression. Is he undergoing some stress or something? The ventral flatness, the bottom, consider legs, hips, lower bowel and possible headaches. Then the superior temporal cervical area shows problems in the neck and shoulder areas, possible issues with hearing also. Then the medial cervical flat pupil area indicates face issues, upper neck, as well as issues such as bite problems and TMJ issues. Then temporal thoracic flattening on either side indicates lung, heart tissues and nervous breathing. There is also the possibility of bronchial or breast impingement. Then lumbar temporal pupil flattening indicates that the issue in the reproductive areas, especially the ovaries, testicles and the pelvis, as well as the lumbar spine, and arm and shoulder weaknesses, because that area corresponds for that issues. Then the medial sacral and lumbar pupil flattening, the uterus, prostate and the bladder, as well as the lower back, so inferior nasal as well as L1 to L5 in the spine. So when the pupil is flattened, the nasal or the medial point, the thoracic spine is indicated, as well as the throat, thyroid areas, breathing and the heart. Then pupil ellipsis, which is a serious condition. As I said, when there is an ellipse, it's a serious condition. So vertical ellipse, danger of hemorrhage or a stroke. So even before a person gets a stroke, if you see there's a ellipse in the vertical way, it's happening, that means he is heading towards a stroke. Glandular disturbance with influence upon the heart and respiration, check for the thyroid, depression and motor disturbances if it's on the top side. Left oblique, left side paralysis, impotence, leg strength issues. Right oblique, right side paralysis, urinary and reproductive issues. Ventral diverging, weakness in the lower extremities, paralysis, muscle spasms, etc. Frontal diverging, crying, that is excessive crying, anxiety or danger of a stroke. Then this was one interesting research publication. I mean, there are a lot of research articles which you can browse through. One was done on dialysis patients undergoing, who are suffering with chronic renal failure, already undergoing dialysis treatment. Okay, so areas with kidney area, there are strong lesions or lacunae which have formed. So by just observing it, they have recorded, and before and after pictures are also available in that link. If anyone of you are interested, you can go back and read those articles, and once you go there, there are many other articles which have documented evidence of iridology. Then just for this thing, all of you must have put various metal poisons and their color they reflect. Have you done that in your records? No, because I am not from your college, I don't know what all you did in iridology. Whereas from Government Nature College from Hyderabad, we have a full chapter for all toxin deposits which happen inside the iris. So just that, just to refresh, I put it. So if there's an iron deposit or iron metal toxicity, this is how it looks: iodine, opium, sodium rings are the now sodium rings, what are they called, and arsenic and mercury poisoning. Okay, these are the various things. Okay. Then this is for the acidosis, as I said, hyperacidic or acidic nature of the stomach. Then basically, okay, all this is very, very interesting, very nice to hear, but how do we practice? That's where it becomes very, very important, right? How do you, as a student, as a doctor, or as a clinician, as well as a research purpose, whatever could be your purpose, where do you start, how do you start? With a very blank face, you're looking at me. Where do we start? How do we start? What is required for you to check someone's iris? A good light and a simple magnifying glass. I asked for some magnifying glasses, just check with him, they're brought. Okay. Or now something which has become a part of your body, which all of you possess. What is it? Your mobile phone, that has both a light which acts as a torch and also a good amount of magnifying. No? No problem. No problem. No problem. No problem. So the other option is magnifying glass is already with you in your mobile. That is, just zoom in, it acts as a magnifying glass. So just open the torch in your this thing, just look closer to the other person sitting besides you, zoom in, you will be able to see much more clarity, right? Even with that, you can start just recording pictures. Then start observing. So whomever, I mean, if you are still a student, take iris photograph of all of your friends. I mean, all your classmates, roommates, whomever you have. Then take monthly ones or compare them over a period of 3 months to 6 months. It is not the same picture what you'll have. The typical crepes or lacunae which are already formed may be there, but there would be a lot of variations which keep happening, which changes. So based on that, you can start interpreting. Whereas if it is patients, see, now you are in a dental this thing. All those who are suffering with dental problems are, once the root canal treatment is done, there are certain changes which happen. You can, if you are coming here, you can just request, I'll take your iris photograph. They'll also be curious. You can give them a lecture of a minute, telling that seeing your iris, we can interpret a lot of things. That's how they'll get interested into naturopathy. They'll start looking at it as if you're a magical reader, right? So what all you require is an adequate lighting, a good quality camera phone, which all of you will definitely be having already, and someone to guide you or hold your iris, or someone, a friend, who is ready to allow you to take a photograph. Okay, so this is a simple magnifying glass with an LED. Instead of a focused torch from your mobile, if you can invest 300 to 500 rupees, even in Mangalore, you can get it in all bookshops and other places. It has a around the eye, so it does not disturb your iris. Around the eye, the focus would be better, but you can just look at with this thing. So just keep it in your pocket. Wherever you are going, you can start observing the other person's iris. Or this is one more. This is basically for iridiagnosis only. It comes with a good magnifying. It almost magnifies by 10x with a 2 light this thing, not to put much of a light, just adequate lighting for iridiagnosis. This is a special this thing available. It costs you around $225 to $300, including import charges, which you can just put it to your mobile and then start using it. Okay. Then this is an instrument basically which I use basically for iridiagnosis, where you can take the printouts. Maybe I'll just demonstrate and show you in 10 minutes here. I'll not go into details of it because most of you will not possess it. Just wanted to see what equipment you have here. I heard you have a iridoscope. What you have, is it there just to show? Not here. Okay. Because at least if I know what instrument, I can tell you how to use it. That's it. Okay. Basically, I'll just demonstrate this instrument, how to use it, how to record, and before and after are two iris are the same, this person, you can always compare and give a printout. Then request, because you are in such a wonderful institution where the budget is not a really dearth, or for NIN also for Madam I have been insisting to buy this. It costs around 20 lakhs total, and including import and everything. It comes with a built-in software where you can magnify 50x now, 50 times, so absolute those beautiful printouts what you see online about the iris, we can get wonderful pictures. So if this is expensive, that costs around 2 to 2.5 lakhs. Or at least in smaller institutions can buy a stand like this where the person's chin gets fixed. You can keep your mobile, you can move it forward or backward to the accuracy and then zoom in and take a picture. Okay, any of these are the various options. And if someone is really interested to study in detail, there are a lot of textbooks available. So you can ask to get to for library purpose at least. If you don't have them, there are a lot of textbooks. Okay, so these are a few textbooks which are authentic and very good to study. Okay, then these are the various references from which I have taken up. So can we just for a minute, I have time, so that's why I've just finished it faster. I'll give you 5 minutes. I want all of you just turn it to your neighbor, switch on your light, zoom in and take the right and left picture. Meanwhile, I'll set up and try to get my equipment ready. Okay, just do that. Start observing. After my session, is there a break? After my session, there's a break or immediate? Break is there, no? Then I'll put my laptop here so that I can just demonstrate. Nothing, just a laptop. I mean, all that can be there just for yeah, projection. If I'm able to connect, that's enough.
We will not know, sir. Otherwise, we could have get it from.
Yeah, no problem. No, yesterday while coming, he was discussing that we have an equipment, but we don't. Anyone specifically something very interesting where you want me to come and or explain? Or all eyes are looking same and normal? Okay. A good picture you have taken. I'll just explain you, just I'm giving you 2 minutes.
You took shades this one.
It will come on. It will come. Yeah, just for reference, I'm just once again showing the chart. See, I mean, this is the quality, the picture which they have taken. You can actually see it's as good as any other picture with which you can directly start interpreting. That's why I said if you have a good mobile phone, you can just put the torch, you can all of you see. It's so clear, right? So basal diagnosis, this is more than sufficient for you. So you take a picture of your patient or anyone, you start observing, you can just keep that chart with you and see in which area, what interpretation, what it is showing. Okay, so basically, okay, right eye. So we are not going discussing it officially, okay, but you can see these changes, especially where you have this deformities or whatever you call lesions. Compare it with that area. So those are the areas where you have issues. Okay, you have a back pain. You have a back pain, right? So that is reflected. Just give you a hand. So I'll also support you. You have a severe pain. Okay, just press it in the GB30 area. Just press here, GB30. GB30 is this, here, this side, not back. This side, sideways. There. Press here. With the thumb you press. She'll have a strong pain, right? So that's what immediately you can relate it. Like that. See those areas, wherever you have a crepes or something. So those are the areas where you have to start working on. After my session, yeah, we'll talk personally. If you want them a prescription for you or something, we'll do. Okay. Yeah. Good. So this is also again a very good photograph. So advantage with your mobile is basically you can zoom in and see also, right? So this is the right or left? Left iris. So left iris basically, which area is this? Just beside 6, right? So do you have your pain in your thigh and lower back? Yours? Give your hand. So this is the reflex area for your spine. Do you have a pain when I press? So this is pressure. Here do you have pain? No? Then that's a little sided to the left iris means. Then basically, see this is a lesion for pelvic area. I mean, So here, I think almost 100 students, 100 of you are the participants, right? See, all of you have seen how wonderfully you have taken. Every one of you have taken so many pictures. Actually, among your age group, I never saw so many lesions and other this thing. That also I'm telling. Now, whoever called me and showed you, all of you have so many wonderful changes inside you. That means why I'm calling it wonderful is documentation has happened there itself. See, now if we take 100 into 200 iris photographs we have just in this room, which you can start documenting and observation. That's how simple you can start iridodiagnosis. Okay? So give yourself a big clap first for starting it up, right? Now the curiosity is what is going to help you to really start. Okay, charging is over. 1 minute. Now, whoever has those lesions, basically as I said, every lesion shows or says there's some stagnation inside your body or requires some cleansing, right? So, now your body basically, when you are able to remove that lesion, that means that area is completely hale and healthy, right? That's what the iridodiagnosis said. So now, how do you get rid of those lesions? Is where you have to work on yourself. First, even before talking to some patient or saying naturopathic treatments work, start working on yourself. Many of you already have nerve rings. That means a lot of stress is there. Start doing a little of pranayama, do a little of meditation. And whoever have digestive system issues, start fasting or detox for yourself. Whoever has circulatory issues like low, I said for few people you are anemic, someone has a PCOS issue, someone has a back pain or back stiffness and other things. All those are being shown in your iris. Start working on it for a month or two and then again take a photograph and see there is a difference before and after. That itself gives you a confidence, yes, this is actually works. And that will start making you to go to your patients and start observing their iris and start giving you interference. See, don't worry. Finally, you are not documenting or it's not something that had to be 100% guaranteed, right? Basically, once you look at the chart, you can give some inference to the patient, right? See, once you, I think it has come, it has come, it has come. Yeah. So basically, once you have in this area, whatever those areas represent, you have a lesion, just say, I think in this area you have a problem. What problem? If you want documented evidence, go for further this thing. Suppose there's something with your reproductive system or lower abdomen areas, you find some lesion, a strong crypts. Crypts is a darker enclosed lesion. Okay, just ask them to get an ultrasound done. Or you only go get your ultrasound abdomen done. Or there's something else in your chest, get an X-ray of your chest, lungs. Basically, we'll have some strong lesions. Basically, you might have had bronchitis or some asthma or some living in a strong polluted area, you will have lesions in your lungs. So that is what is getting reflected. So now how do you remove or clear your lungs? One is pranayama. What else? Pardon? Vamandhavati. Another thing, basically cleansing process. You do take enema regularly, okay? Or cut down on your, if frequently you have some lung issues, cut down on your milk and dairy products basically, okay? And start taking steam baths. See what differences you will have. Just after 10 or 15 treatments itself, because it doesn't cost you anything, just one photograph, right? You can ask your friends to take your photograph before and after. 10 days, 15 days intervals also, you can start seeing some changes in your eye. That's what you need to start off. And that starts the magic of iridology for all of you, okay? So then I'll just demonstrate and show you. This is any volunteer wants to come, just to take your picture, we'll be projecting it on the screen. If that's okay, please come. remove your specs. So basically this is the software, this is the lens what we are using for capturing an iris. Okay. One minute. What's your name? Age? Okay. Rest of the information I'm not taking. Okay. You want me to send it to your mobile? Your phone number? 6363 46
Age 54.
54 వచ్చిందా? Sorry. Oh, sorry. It's taking someone else 1 minute. Okay, okay. You got date of birth March. What's your year of birth?
2001.
Month?
August.
Okay. Yeah. So basically, see this is with both this thing. You press this side, you will get one eye and the left eye. Okay. Again, you press it, it will come. Okay. So basically, I'll take it out. You turn that side. You'll be looking into that so that you center focus at your iris. I need the right iris picture first. Yeah.
Completely I should keep my
Just keep it closer. Okay, look straight in the center. Okay. Yeah, look at the center. Down, further down. Yeah. Open up your eye fully. Right, good, okay. And just for the purpose, down a little, just with the iris, sorry, just press it, close it if it's irritating you. Again, open up. Lower side, see, open up fully like this. Yeah. Look in the center. Down, little down. Center. Look there. You turn. Yeah. Now you look in the center. Yeah, like that. Open up your upper eyelid also fully. Look a little towards the side. This side. Yeah. Okay. Close it. Change the eye. Look down at the center, open fully, upper eyelid, lower eyelid also. Just focus it there. No, sorry. Yeah. Look at the center. You can close one light. Yeah. Just once again, one more. This side. Look down. Yeah, like that. Good. Yeah, that's enough. That's enough. Thank you. Yeah. So basically, what you can do here, I'll just explain you. Now, for basic observation, for diagnosis, everything, your mobile picture is sufficient. Now, for giving a printout to the patient, that's where this comes in. Basically, I'll just show you how to use it. So, you go into the analysis. Sorry. One minute. Chat. Just a minute, sorry. Now, we are selecting the right iris, we are selecting the left iris. So, these are the two photographs, basically what we have taken. Now, go into analysis, it will pop up the right iris. Then, you can actually start with set parameter. So, you select the iris border, then the autonomic nerve width, that I just did this thing, and the pupil circumference. Okay, so once this is done, you have various this thing. So showing the organ. Suppose wherever you have a crepe, suppose you come in into the iris analysis, it will show which area this is. Okay, so it guides you basically in easily identifying. Suppose there is a lung issue, you have a lesion here. So what area that is? The reproductive area or a parathyroid area. Like that, you will be able to easily identify and then mark it over. Okay. Suppose I'll just go for one or two only here. This is a lacunae here, right? There's a closed lesion. So light brown in color. In the right eye, you have a lacuna. Any spots? This is a crypt, you can say. Okay. So add to the report. This is a transverse colon, you have added. Then cancel the analysis. Go back to the left eye now. Again same, set the parameters. See here, if you want to adjust the angle, you can change left to right or right to left if the picture was not taken. Or you can readjust the center, or you want the gradients like that, you can iris map, you can change this, or without this also you can see. Like that, various options you get which aid you in doing it. Okay. Now going back to the iris analysis. Without this, if you want to cancel the map, it will cancel it. If you want the map, you can keep it. If you want to see which section exactly, whether it's 3 o'clock or 4 o'clock or what exactly it is, you can see. Okay. Shoulder, you have a strong lesion. So add it here. This is in the hip area. Same way, here one in the small intestine, like this. So then you save. Okay. You want to review what you have seen, you will be able to then close it. Then client report, if you do it. So here I have Abhinay's report with the photographs and whatever you want to give. Below that you can give your observations. All the observations you can. So directly with the their name details, both the iris, you can even compare both the reports. If you have a previous report and this report, you can compare two reports like here, before and after. You can have both comparisons, how much changes in the iris has happened, that you can compare and give. Or you want to educate the patient regarding something, you want to show eye samples of a normal eye, what is a normal. So this is a relatively healthy iris. Suppose I want to explain. So taking her eye this side and comparing it with some other this thing, what is a lacunae, what is a spot is, or what are 12 symptoms basically. Anything I want to show like this, I can explain and show what is normal and what is abnormal. Okay. So like this, you have basically by using a software, you will be able to give it. So once you start your own practice or once you are in a clinic or an institution, I would always suggest having a documented proof. But now to start with, what you have done right now is an excellent job. Many of you use your mobile perfectly well to take beautiful pictures. So as many pictures as possible, start capturing. And that's where your iridioagnosis starts off. Okay? So any other doubts, any this thing you want, I can talk. Another 4-5 minutes I'll take and then give a break. Anything else? Yeah. How many of you are from the same places? Exchange your photographs, whatever you have taken, if that is okay for you. Just form a WhatsApp group, exchange and start comparing. That also you can do. See, 10 of you having 10 photographs of yourself. So that's where the interest comes in. See, basically what I want is not to listen to this lecture and leave it and go away. Start utilizing this. Whatever you have gone, now you know how to take a picture. So start utilizing. Whoever is your staff who is there, take their support, go to the library, you'll have some books or the other, or your senior records or something else, you'll have, sit and discuss. There's nothing wrong. There's no perfect science which is need to be brought in with your report. It's just for a comparison, it is for knowing not that something is wrong with you, but what can be improved in yourself. That is the purpose of iridioagnosis. So it is not to know that you are suffering with a disease or you are having something which is incurable. It is just to know that certain area of your body is under stress or needs a repair or needs cleansing. Okay, it has a lot of deposits or it's under stress. So once you provide back the nature requirements what it requires, either in cleansing, detoxifying, excising, whatever is required, okay, it will start improving and start recording it. That yes, from this position to this position, I have improved. Okay, thank you. So, yeah.
According to which chart we should interpret, radial or circular?
Pardon? Bernard Jensen's is the easiest for you. See, because it's a pictorial representation. See, you have complex charts. If you want to go for complex charts, I can show you a lot of things. As I just showed you in the PowerPoint, 1 minute, sorry, I closed it. See, like I mean, there's a smaller this thing. You can magnify it and see. See, this is the easiest because to begin with, you have pictures there. Areas are bigger, so approximately in that area you can start using it. But if you want to go for specific or much more detailed ones, then this is much more detailed actually. Bernard Jensen's chart only, but much more detailed. And there are other charts which are even more complex. Minute areas are also mentioned in that. Like this chart, if you see, there are many more details. Like that, you can choose your chart to work with and start working. Okay? Yeah.
So sometimes one iris, it looks fine, and they have some issues. It is not visible in one eye, but the other eyes, when we see, there are all the changes. Why is it?
Okay. Now, very rarely that happens. You are representing two halves of the body, left side and the right iris. So, suppose, I'll just to give you an example. Suppose left ovary versus right ovary. Both need not be the same. There could be some changes or a small, this thing, cyst inside the right ovary. Left ovary need not have it. And that's what could be being represented. Or scar tissue inside the lung or in a breast tissue. Okay. Suppose only left breast there are certain changes and right breast might be normal. So that's what is reflected in either side of the iris. It need not be the same. That's what body is not the same throughout. It's a mirrored opposite. That's how iridioagnosis talks about. So you will see the same changes inside.
And some iris, the fibers are very unclear, like we cannot predict any changes. We hardly find any changes.
That means the constitutionally strong. It's very easy for them to recover even if they have an issue.
Like we cannot see, sir. Like,
See, you're telling constitutionally strong fibers, that is very closely interconnected. See, that means, what does that mean? Constitutionally or genetically, that person is a strong person. Okay, so he will not suffer, and if they are suffering also, it's easy to recoup also. So if you find some issue and that you are not able to find in the iris, don't worry. It's only that we are not able to relate to it. By taking and zooming in, magnifying, definitely you'll be able to observe something. I'd just ask them to go on a routine cleansing diet, or just go on a fasting diet or something. If you think there's some kind of a detoxifying required, that change you'll be able to find before and after. Okay, so never have a preset mind that, okay, this problem is there for this patient, how to find it in the iris. Never go with that. Look at the iris and see if you can find it or not. That's all. It's not with, okay, suppose tuberculosis is there for some patient. Can you exactly find TB inside the iris? No. You will only see that there's some scarring or some problem in the lung area. That's all you'll be able to see, are strong lesions inside the lung area. Okay. With that, you must be able to start off. Okay. And many times you may have some very strong things showing up in the iris and the person looks almost normal. But many of them must have healed and some scar tissue inside. Okay. See, like some menstruation issue is being shown. When we ask, they say, no, my periods are absolutely regular. It could be just a menorrhagia. Okay. A dysmenorrhea. A strong, I mean, they have a very strong pain just before or during the period, which unless you ask specifically, they may not even reveal. Like that, there could be something which is being represented. What it is, you need to ask questions and get the information from the patient. Okay. Any more doubts? Thanks a lot. So hope I could give some insight into the diagnosis. Start diagnosing. Okay. Thank you.
Thank you, sir, for the wonderful practical session.
Thank you.
Now I request Dr. Shagupta to present the token of gratitude to our guest speaker.
Thank you.
Now there is a 5 minutes tea break will be there at 11:30, 11:35. Sharp, you have to come here.
Yeah, just a few minute information. I hope all of you signed your attendance for today. So if not, just kindly sign that and make sure your signature is there in the attendance. And second thing is, yesterday in your kit, we had provided NN magazine subscription form. Hope everyone have with you in hand now. If not, few copies they have outside also, you can get it. And kindly fill the subscription form so that you will get a 1-year subscription of magazine, NN magazine, free of cost. Okay. And another meanings, in that kindly mention your home address. You people from various colleges, don't mention the college name. Your personal home address, just kindly clearly mention, then you will be getting the magazine throughout the year for next 1 year. Okay. Thank you.
Hi.
2011 pass out.
Okay.
I would like to purchase this, sir. So,
Just give me, contact me then after 2 or 3 days. I mean, basically it's an imported from China. I need to import it for you and give you.
okay, so what will be the cost?
Cost around 55,000 for us. Where are you practicing?
Sir, I have my own clinic in Kasaragod, Kerala.
Kerala. Okay. Wonderful. Nice. Thank you. Yeah. This is the right iris, right?
Yes.
So again, lower back. Whose eyes? Give your hand. The hand. Just you have pain here. So you have back issues already. So back and leg. Your hip also is paining. Thigh. So it's a scar tissue. Ovary, you have an issue. You have it. I mean, get it checked anytime ultrasound abdomen was done. Get an ultrasound abdomen done. Okay. Basically lung and thorax. Again, you have an issue. Any period during periods your breast tenderness is there. That's it. So basically, see, whatever this shows, there is something which we need to find out and see. Okay. Uh, See, on this side, your bowels are also inflamed and irritated right now. So, again, see, a lot of deposit on the right side. This is not a deposit, it's clear that it shows the irritation.
all those things we'll give, and at the end of 7th day, 8th day, 9th day, this was a challenge for me when I completed BNYs, and even until I was entering inside my clinical practice. So after 7 days or 8 days of intervention, the patient will say, my pain reduced by 70%, maximum 70%, still I have pain. But can we make our treatments to work better? Yes, it is possible with acupuncture. Hardly within few seconds, actually, we'll be able to relieve pain. And one of the simplest strategy to relieve pain is that whenever you're having a patient with sciatica or low back pain, any stage it may be, you look at the UB40 area. You look at the UB40 area, which is like in the popliteal fossa, right? So you will be able to see a dark vein, superficial vein, which is flat, right? It shouldn't be like a varicose vein. Varicose veins are always protruded, right? So these veins will be dark and flat in nature. You just puncture them. You just puncture them with a three-edged needle, right? Or otherwise with a good gauge, simple surgical syringe. You just puncture it superficially, like 2 or 3 millimeters, and blood will be oozing out, right? Sometimes it will be like from few drops to few milliliters. Okay. So ensure that before doing bloodletting, you have to sanitize that area properly with povidone iodine solution or minimally with surgical spirit, and then just puncture it, and then ensure that you are using appropriate strategies to kind of prevent the blood from spilling, allow the blood to flow. You don't have to press, you don't have to do any massage, anything. Just make the patient to lie down and do, because whenever you're doing bloodletting, making the patient to stand, some of them might feel giddy, so make them to lie down. That's the best option to do. And then once the blood flow stops, you can just put a simple band-aid, an adhesive tape, put it, and then it's fine. By the time the blood starts to flow out, the patient will already say the pain has started to relieve. So we have several patients who have been benefited with this bloodletting. I will share some interesting case details as and when it is appropriate. Right? So what do we do basically whenever we are dealing with acupuncture? So we basically say we remove the excess and then we fortify the deficiency. If not, we warm the cold and then we remove the fire. So in whom do we say do acupuncture? So most of the times, even in traditional Chinese medicine, they believed in prevention is better than cure. So what do they say? They say usage of acupuncture or herbs were for people who did not follow appropriate lifestyle. So so when we look at the history, so this was a kind of an interaction which was happening between the Yellow Emperor and the Kubo or the teacher, master. So this Yellow Emperor asks, before few years, this was happening before thousands of years. Even then, this king was asking. Before hundreds of years, people were very healthy. Even at even when they were aging, they were very healthy. Their joints were all very flexible. So how were they able to maintain their health to be good without having any weakness? So for that, the heavenly teacher, he says, these people knew the way of right living. So they followed what is appropriate, taking into consideration the seasons. So when they were following it, when they were able to, when they had the knowledge of knowing how to live, they lived the healthy way. So going further, he mentions, it is in the Suwen textbook. So it is mentioned, they give like 6 recommendations for an individual to stay healthy. The first thing that they say is maintain regularity. So this kind of corroborates with the present day evidence as well, right? So what do we say? We have our circadian rhythm, and everything in the body follows a rhythm, right? We have an ultradian rhythm, we have a circadian rhythm, right? So everything in the body is kind of harmonic, follows a pattern, and the present day lifestyle that we have is all about breaking the regularity, breaking the routine, right? So once again, follow naturopathic principles to go back to equilibrium or go back to our similar routine, right? So what we need to do is about maintaining the pattern of regularity. And the second thing is, which they emphasize, is kind of doing an exercise without actually getting excessively fatigued. and then need to adopt proper eating habits. Each of these topic, they have a huge recommendation and huge points to discuss, a good amount of literature to discuss, but we will limit with this. Yeah. So proper eating habits, living in harmony with the seasons, and celibacy, and the other one is maintaining proper mental outlook on life. So all of this is what we have also, even we have better information regarding. So now, once you are entering inside this aspect of diagnosis, it is very easy and very simple. Whenever we are practicing medicine, it is easy and simple to kind of recommend medicines. But what they say is that using medicines is not that difficult, but difficulty is in recognizing the syndrome. Going further, they say recognizing the syndrome is not that difficult, but it's actually difficulty lies in recognizing the yin and yang. So unless and otherwise we are able to diagnose the condition appropriately, our treatment strategies would be not appropriate, which is in a way going to hamper the outcome. Right. So in our TCM, I have always, I don't kind of, using TCM has been more political, but yeah, so there are multiple schools of acupuncture, multiple schools of diagnostic strategies. So I have tried to kind of pick and choose the ones which are kind of effective, and some selective information I'll be sharing further. So what we will be discussing today is mostly about PAMA diagnosis, right? And we will be speaking about auricular diagnosis and tongue diagnosis. So with respect to pulse diagnosis, you already had a session yesterday, but I will kind of throw light upon 2 or 3 other special pulse which will be of special interest to you in clinics. So with respect to PAMA diagnosis, the first area which we are going to discuss, same like balanced method of acupuncture, you can adopt the strategy. Acupuncture 1, 2, 3 is what they call in balanced method of acupuncture. Here in PAMA diagnosis, you can like use it as 1, 2 and 3. What's the first step? The first step is to identify which palm we have to use. Okay? So which palm we have to use. So going with the famous strategy, women are always right, right? So use the right hand for the females and use the left for males, as simple as that. So and the next one is to identify which what are the signs that are present in the palms, right? So that will be the second step. And once you identify the pattern, the third step is to take inference from the signs, as simple as that, right? So going with general information about PAMA diagnosis, whenever you see a kind of redness to be present in the palm, it indicates a state of inflammation to be present. And if you are seeing an area in the palm to be kind of brown or dusky or dark, it indicates stasis of blood. And if you are seeing a palm to be pale, I will share some images, it will be giving you a better understanding. But if you see your palm to be kind of very pale, it basically gives you information that that particular area is deficient, or the organ that is imaged in that particular area is kind of not functioning properly, and blood circulation to that particular organ is hampered. And if you are able to see veins, it also indicates there is a problem, an abnormality in that organ which is imaged in that particular area. So you can look at your own palm, okay, right for the females and left for the males. Okay. So you try to see if you are able to see any veins that are present in your palm. Okay. So some of you might see green color veins to be present, some of you might see greenish blue color veins to be present, some of you might see blue color veins, purple and dark brownish black color veins also to be present. Brownish black at your age, if you are completely stressed, you might be able to see in the P6 area, pericardium 6, right? So that is most commonly seen, right? So similar to iris diagnosis, more darker the vein, more severe is the pathology, as simple as that, right? So the order of severity goes like this. So if it is an acute illness, if the condition has kind of started to set in, then it will represent as green colored veins, And as and when the condition becomes more severe, you can expect it to kind of gradually progress towards darker or black colored veins to be present in your palms. So one of the strategies that they recommend is doing bloodletting. But bloodletting in the palm requires a little bit of expertise. Okay? So the commonest site that we use for bloodletting is here in this region. So especially if you are able to see dark colored veins present in this region, most of you can see. I believe people of this generation, you should be having dark veins here. So because of improper diet habits, as simple as that. So if you are seeing some dark veins, if it is superficial, if it is flat, right, always remember this rule. If the vein is flat, if it is not, it has to be flat, right? If it is flat, you can just puncture superficially, allow a few drops of blood, and you can see a remarkable improvement in the functions of that particular organ. Right. So there are two charts actually, which I would like to share. First, I would like the one which you are seeing here is the basic one. So can we switch off the lights here, please? Yeah, thank you. So there are two charts. The first one that is projected here is the basic one, and the next we will go into the deeper ones. So when you look at the thumb, the thumb usually indicates the head area, right? And when you're looking at the index finger, it basically all the way from here to here, it corresponds to the functioning of lung basically. So if you are seeing any change in color, any veins to be present there, if there is atrophy of muscles here, it can be correlated with lung conditions. If you are seeing similar kind of changes in the color, presence of veins or loss of muscles in the middle finger area and down below, it can be very well correlated with the cardiac ailments. And the third one is for the liver, and kidney is usually in the sides basically. Kidney is usually in the sides. So in between your ring finger and little finger in this area, it can always be correlated to the functioning of liver and gallbladder, as simple as that. Yeah. So this can we remember? So if you are clear with this basic version of the chart, it will be easier for you to go to the little better version of this Palmer diagnosis. So this is the Palmer diagnosis chart that you can employ basically. So this also goes by the same logic. So if you see here, this index finger is for the lungs, the middle finger is for the heart, right? The ring finger is for the liver, and the little finger usually in the ulnar border. Ulnar border is for the kidney, right? Is for the kidneys. So usually if an individual has some renal disorders, this ulnar side of the palm, it becomes little darker, right? Becomes darker. If an individual has got some cardiac ailments, then you can expect the middle finger area here to have some dark colored lesions. Sometimes people might have hemangioma to be present here, or some red color patches to be present here below the middle finger, right? So these all indicate some cardiac ailments, but you always have to remember one word of caution. With respect to Palmer diagnosis, it also gives information, has some predictive value. This individual might not be having that pathology as of now, but it shows that these individuals have a greater predisposition to develop that pathology, right? Fine. Any doubts until now? Yeah, good. So let us take some images to kind of discuss. Yeah. So the first one is about the lung tongue area. So this is the area, right? So this basically reflects the digestive functions. You can see here there are some veins that are visible here. Are you able to see some veins in your hands as well? Yeah. Does it correlate with your digestive functions? Yes, no? Correlates? Good, fine, right? So yeah, so this basically indicates presence of cold or dampness and different levels of blood stagnation, right, leading to digestive weakness. So this is basically because of improper dietary habits. Yeah. So this is one another example. So you keep looking at the colors, right? I have tried to compile different colors. So this one is like a basic one, like greenish one you are able to see. This is kind of very acute. Most of you should be having a greenish one, right? So look here, it is kind of little darker, right? Little darker, and proceed further. What has happened here? It has become, it's not so very clear when it is projected, but still if you are able to see closer, it becomes very much dark here, right? So dark, and what do you see here? This area, the lung 10 area has become sunken, right? It has become sunken. If you just touch the area and see, you won't feel, the muscle will be kind of very flabby, right? So that indicates that the digestive system is not working properly at all. Okay. So if it is dark, if you are able to see blood vessels here dark, the condition is more severe. Fine. Yeah, this is one other example of this sunken lung 10 area. So basically atrophy of muscles. So there is extreme weakness of digestion. So what do? We have to basically avoid the food that are difficult to digest, and maybe put the patients to fasting. So that will be very helpful and appropriate. We will not discuss about the treatment strategies here. I will limit myself with that. Yeah. And another interesting thing for us to kind of identify how strong is our digestive system. You can just look at your palm. If you are able to compare the width of this joint to the tissue, to the width between these two joints. Right. So basically what do? You basically you have to compare the width of this joint, right, to the area here below. Okay. So if you are able to see these two are of the same width, it simply means your digestive system is good. Look at mine, it is thinner, right? So my digestive system is weaker. I have that, right? So you can observe yours as well. Matches? You can just look at your thumb. Okay. Matches? Yes, no? Yes, no? Feedbacks? Matches? Yes, no? Matches. Right? Shall we proceed further? Yeah? Right. So, you see here, yeah, fine. We have lots of observations to make. Yeah, we have lots of observations to make. Yeah. So you see here, this is a very clear indication, right? So this area, this dimension here is very smaller. Right? It simply means these individuals are more prone to have digestive problems. It can be as simple as indigestion, it can be gastritis, it can be ulcers, it can be constipation, it can be IBS, right? But these individuals are more prone to have digestive disorders. Fine, right? And the next one is with diagnosing fatty liver. Okay? Very simple diagnosis. If the fingers are more wider than the joints, if the fingers are more wider than the joints, it simply means these individuals are having fatty liver. Their cholesterol levels are higher. I believe most of you won't have this, right? But you can always remember it and check it in your patients. Okay. So I mean, this round is for indication, but all the fingers you can compare. All the fingers you can compare. So if it is kind of chubbier, if it is kind of wider, it simply means these individuals are having fatty liver. Right. So how do we diagnose high cholesterol? So as soon as your patient walks in to your clinic, just ask them to show their hand. Make sure that you are choosing the appropriate hand, and just keep as if you are doing palmistry. You can just observe. Okay? You can see, look at the strength of their digestion, look at how good their digestion is, their temperament, right? And then you can always look for some atrophy in the lung 10 area, and you can see What? The color of the creases. The color of the creases. If the colors are darker, right? If the colors are darker, these individuals are more prone to have greater elevated cholesterol levels. Yeah, elevated cholesterol levels. I mean, this will be more relevant in your clinics. Clear? Fine. So, while you observe, whenever you are observing, look at the color difference. Look at the color difference. Do you see anything distinct here? What is distinct? The distal phalanges, right, are reddish as compared to the other parts. Okay. We will see what it means, but whenever you are looking at any palm, try to observe everything, right? Yeah, so look at this finger once again. So what do you see here? Dark crease to be present, and you can see the fingers to be chubby, right? So fatty liver. And some of you might be having this sign, right? Those whoever are having allergy, look at your palm. Right? My palm is like that. Right? So look at your palm. It will be like patches of red and white. Patches of red and white. If you are having this multiple patches of red and white, these individuals are more prone to having allergy. Okay? So you don't have to just limit with your palm. There is one more test that you can do. So even when you are observing the forearm, you can just observe whether it is fair in complexion or brown in complexion, whatever complexion it is, relatively the forearm here will be fair, right? So you try to see if here also you are able to see this ground meat kind of appearance, red and white patches if you are able to see. If you are able to see, then once again it means that you are having an allergic constitution, right? So what do? You can use your finger to kind of give a gentle pressure for a few seconds and remove it. Right? When you are giving a pressure and when you are removing it, you will be seeing a white color patch there, right? So blood will be, peripheral circulation is obstructed, so that area becomes white. As soon as you remove your finger, within few seconds, within 1 or 2 seconds, it has to return back to its normal color. If it is taking more time, if it is taking more than 3 seconds or more, it simply means this individual is more prone to having allergy. Okay? It's a simple test to detect allergy. Okay? Clear? You can test on your own self. Yeah? Fine, clear? We'll proceed to the next sign. Yeah? Fine. So the next one is looking at the pericardium 6 area. So we know pericardium 6, right? From the crease it is Tuchon, right? So when you are looking at the pericardium, this entire area is called as pericardium 6 area. So this kind of can be correlated with 2 attributes. One is the lower GAO, right? And the other one is about the mental stress. 2 things, right? So lower GAO, once again, I mean, goes with the holographic theory. It can always be reversed, right? So this is lower, it can be lower GAO. If you reverse the image, it can be the upper GAO. So it usually correlates with 2 things. So if you are able to see, this also most of us will be having. Okay? If you are kind of stressed, you will be able to see veins to be present. The more darker, more chronic and more severe. You are able to see. At least I have seen almost 90% of my patients in the clinic. Yeah. So the greater your stress, the veins will be present here. Clear? Yeah. And interestingly, yeah, if you have doubts, you can raise hands. You can ask me rather than talking amongst yourselves so that you are missing some information. Yeah. Anna?
From my childhood, I have this. Is that my color complexion or?
Right, Amma.
Right.
No. It should be your temperament. Mostly, maybe like you might be having a tendency to be. Anjay, show your hand. Show your hand, spread your hand like this. Yeah, you have a blue fiber here along your lifeline. So I will come to that sign later. Right? Hold your question. You have answer there. So, right? So, you hold. I'll answer that question a little later when we are coming to the appropriate slide. Right? So, see, for example, you can see in mine as well. I am a person who kind of is always getting anxious, right? So, like, yeah. So what happens? You'll be having that veins to be present there. Right? So, the more stressed you are and more severe your stress, so you'll be having the darker regions to be present. And in some people, relatively, this PC6 area will be very pale, right? Very pale. So in these people, you can always listen to them mentioning that they always have this forgetfulness. They always say that they are feeling little dizzy in the head. Right? So if you are having paleness, you'll be able to see this. So most of the times, people might be anemic. Right? So even in anemia, you might be able to see this kind of pale PC6 area. Any doubts until now? No? We'll proceed to the next sign. Yeah. So, when you are looking at this Palmer diagnosis, there are like two things that we kind of, two terminologies that we kind of use. One is like nervousness, the other one is like having anxiety. So what do we mean by nervousness here? So nervousness is like whenever there is a task in hand, these individuals who are having this PC6 area, veins to be present in the PC6 area, they kind of become kind of very little bit of jittery. They kind of start planning things, right? They kind of tend to become little agitated. Those kind of things you will be able to see. That's called as, they become nervous, right? So that is nervousness. But when you look at anxiety, these individuals, even without any reason, they will be always be in a state of, you're getting it, right? Yeah. Fine. So, which side I have to go? I'm getting confused with this, right? So, another example of this PC6 area to be having normal. Only you are able to see one blood vessels to be kind of present here, but there is no discoloration. The complexion appears to be normal, but slightly kind of this protruded blood vessel to be present without any change in color. It basically indicates deficiency. Okay? Deficiency, as simple as that. So these are some images that demonstrate greenish blood vessels to be present in pericardium area. So becoming more chronic to be present, blue in color. Okay? So this is almost black. Doesn't work. Okay? Almost black. This you can see in people who are kind of little older. This may not be present in people of your age, people of my age. Yeah. And sometimes you can also see this PC6 area to be dark itself. The PC6 area in itself will become dark in color. When you look at the color complexion between this PC6 area and the area proximal to that, you can see a kind of a stark difference. Are you able to see? Yeah. So these kind of things will be observed whenever there is blood stasis. So as this area, if it is a female, as this area can be mirrored as lower GAO, it indicates a state of probable amenorrhea. Right? If it is a male, this will be indicating some pathology associated with prostate gland. Right? Clear? Yeah. So in the thumb, so once again, there are different schools which have different thoughts. So initially I said this area is kind of can be correlated with the digestive functions, right? So there is one another school which has got a different idea to detect functions associated with the spleen from the same area. We will not get into these confusions, but if you are able to see a kind of a vein, a dark vein to be present here, right, on the radial side of the thumb where the brown and white tissues meet, right, so that probably indicates this individual has had a history of accident to the low back, a kind of a fall injury or some kind of injury in the low back. If any of you had got injury in the back due to some reason, you are more likely to see a kind of a dark vein to be present here in the thumb region. Okay. So the answer goes here. If you are able to see a kind of this is the lifeline, right? In palmistry, we call this line to be the lifeline, right? So if there is a dark vein, it can be green, it can be blue, it can be purple or a dark. If you are able to see a dark vein here, these people have a kind of a tendency to be anxious. Yeah, tendency to be anxious. If you are, so it can be associated with PC6 area presence as well. So if you have this anxiety, if you are always feeling nervous, right, so you can see this blood vessel to be present along the lifeline and in the PC6 area. Correlates? Correlates? Yes, no? Yes, sir. Yeah. So clear? Proceed further. Right. Yeah. Here are some examples where you can see the lifeline. So you can see a dark colored blood vessel which goes in here. You can see here as well. Okay. Here as well. It becomes darker with severity. So on a lighter note, so these individuals who have this dark veins present along the lifeline, they are taskmasters, right? They want things to be ready well in advance. They have this nature to plan things well in advance, right? Everything they want it to be kind of very organized and very perfect. They'll plan everything appropriately. So if you are looking for somebody in your clinic who wants to kind of help you organize things, if they have this line, you can recruit them already, right? So next, once again, with respect to kind of deviation in the distal phalange of the middle finger, you can see here, right? So the distal finger is kind of slightly deviated. So this basically indicates that this individual is having some misaligned cervical vertebra. Can be a structural deformity. We do not know if it is a simple cervical spondylosis or spondylolisthesis. We do not know. But still, if there is a misaligned cervical vertebra, it will be showing as a deviated. Does it correlate with anybody's? Yeah, does it correlate? Fine. So, in people who have neck pain but who do not have deviation in the middle finger, you can expect deviation to be present in the index finger or the ring finger. That is also possible. That is from another school of thought for palmar diagnosis, right? Clear? Matches? We'll proceed further? Yeah. So once again, you have some examples here, some examples here. So when you have this rheumatoid arthritis, that's a completely different scenario, right? In people who do not have rheumatoid arthritis, otherwise healthy, you can just look at the palms and you should be able to say this, right? Then comes with respect to color. So if the color is red in the heart area, right? So these individuals would be having a history of consuming antibiotics for long term, basically. So antibiotics, they say that they are cold in nature, and heart being the house of fire, so it will be harming the heart, right? As simple as that. So that will be representing itself as dark, red in color, right? So if it is present in the liver area, if it is present in the liver area, so once again it simply means the heat this has kind of taken over, invaded the liver area as well. So that means the disease is kind of progressing further. So you can see here this areas to be kind of selectively dark as compared to other areas. I think most of us will be having this. So even when you don't sleep properly for 2 or 3 nights, you will be having a heart area to be dark, right? So as simple as that. Yeah. So this is like a person who is having his entire palm to be red in nature. So if they are having any chronic condition, people who have been taking antibiotics for long term, like in people who are having tuberculosis, right? So you can see their palms to be kind of completely red, right? So this is something that you need to know. And yeah, like in patients who are having hepatitis, they have been consuming medication for long time, so the entire palm is kind of red. Yeah, can we detect diabetes? So, but in Indian population, I find it kind of little difficult to do, but there are some cases where we have been able to kind of diagnose or identify diabetes. We cannot call it diabetes, rather we can say some impairment with the sugar metabolism. So what do we see? So most of the times here in the ulnar region, right here, if you are able to see a kind of a patch, dark patch like this, right? A dark patch in the ulnar region like here. So this basically indicates that an individual has some impaired sugar metabolism. So if an individual is having impaired sugar metabolism, when you are examining the pulse, in the right hand, in the guan, that is using the middle finger, you should be able to see, you should be able to feel a deep pulse which is kind of wiry, right? It is wiry, but it will be kind of throbbing, very forceful. So that will help in establishing your, confirming your correlation. And yeah, in people who are having impaired digestion, whenever you see darkness to be present here, we said that these individuals will be having impaired digestion, right? So how severe is it? Do we have any strategy to identify? Yes, if you are seeing here a dark vein to be present, right, in the index finger, in the radial side of your index finger, it simply means this individual might be constipated or having an impacted stool in the colon, or might be having some bloating. And once again, always use this order of severity, right? So green to blue to purple to dark, right? Correlates. And if you are having a patient, right, so who is complaining of indigestion or anything, you can always check for the temperature difference, right? So you can check for the temperature difference here in the large intestine 10 area and the palm, okay? Large intestine 10 area and the palm. If you are feeling the large intestine 10 area to be cold, and if your palm, right, to be warm or vice versa, it can be because of presence of parasites. Okay. How do we manage it? I will not get into it. So if you are feeling any temperature difference between your large intestine 10 area and your palm, it can be, one can be cold, one can be warm, or one can be warm, the other one can be cold, whatever way it is. If the temperatures are different, it can be because of presence of parasites. Right. Yeah. So then there is one another interesting way of diagnosing things. So I hope, I mean, most of you here would have studied acupuncture, right? Have you heard of this Bagua? Yeah? Yes? So what is Bagua? Can somebody say? What is Bagua? Yeah, so basically they kind of complement each other, opposites, the yin and yang, right? So from the nature, based upon the arrangement of water to anything, they kind of mutually reinforces each other to ensure that the body stays in harmony. They have picked and chosen, and there are some 8 symbols which are there. So this has a huge relation in diagnosis, and this has a bigger role to play in seasonally adjusted acupuncture. So most of us don't study this in our UG curriculum, but there is one way with which we can make our acupuncture treatments to be better. So we need to kind of employ a strategy, different strategies for different seasons, different strategies for different times in a day. So these strategies will help in improving the outcome, therapeutic outcomes, right? So you can just superimpose these bagwas in your palm itself. So this is the left palm on which it is marked, right? So if you see here, we have the spleen marked here, heart marked here, gallbladder, liver, stomach, kidney, large intestine and lung, right? So take your own palm, left for males, right for females, right? See if there are any lines or veins that are present in that particular area. Do you see any? Even if there are some signs like, oops, I'm sorry. Even if you see some lines like this, some kind of triangular regions to be present here which are enclosed, right? That also can be observed. That will be kind of slightly depressed, right? That also can be marked. If you are able to see some veins or some lesions that are present, it simply, you can say that that particular organ is having some abnormality. We will not go into the details of it, but for now, for beginning, you can simply say that there is some abnormality in that particular organ. So based upon that, you can ask questions to your patient. If you see, for example, a lesion to be line to be present or a depression to be present in the heart area, you can ask the person, immediately you can check for how the circulation is. Yeah, there is one more sign. If you see some blood vessels to be present in the fingers, then simply it means the peripheral blood circulation is hampered. If you see veins to be present in the fingers, it simply means that these individuals have impaired peripheral blood circulation. So if there is a depression present in the heart area, and if there is veins that are present in the fingers, then you can ask your patient whether this person has any symptoms associated with hypertension. That is one possibility, right? So if there is something present in the liver area or stomach area, you can ask if there is something to do with the digestion, okay? So ask, you can, this will help you direct your questions to your patients appropriately. Fine. So now, this is an example of a kind of a depression which is present in the heart area. So this indicates that this individual is more prone to developing cardiac ailments. Okay? So there is one another thing that you can always see. Here once again you can see the periphery, the distal phalange to be slightly broader and more darker. Right? This once again is an indicator of cardiac ailments basically. Right? So see, for example, here you see this triangular region that is present here in the stomach. Right? So this in palmar diagnosis is called as an island. Right? So it has to be kind of completely covered on all sides. Right? So this means that the energy circulation to that particular area is kind of hampered. So this person might be having some or the other pathology associated with the large intestine. So yeah, why do I say large intestine here? This is the right palm and here is the left palm. It is just, you have to mirror it. Yeah, when you are looking at the right palm, you have to just mirror it. So when you are mirroring it, the ulnar side happens to be the large intestine. So if it is kind of enclosed like an island, what do we see here? So some of the other pathology associated with large intestine. It can be as simple as constipation to yeah, IBS to colitis, etc. Yeah, clear? Yeah, there is one more science basically. So this is once again an island. Here in this lifeline, if you see, this area is kind of encapsulated like a rice, right? So this kind of indicates what? Kidney, something to do with kidney. So see, if it is present, if you can see this kind of lesion to be seen in case of males, it indicates some problem associated with prostate gland, and in case of females, if you see, it is to be associated with uterine fibroids or dysmenorrhea or presence of clot in the menstruations, right? Right. Yeah. So this is another sign I think most of us should be able to see. So we have a line here, right? So this line, this horizontal line, just look into it closely. You will be having these, what do we call these? Got blank, got blank. So yeah, so if you are able to see this line, there will be multiple lines which are like going crisscross. If you are able to see some rice-like structure, right? So these fibers will be kind of crossing and they will be kind of encapsulating. If it is present like a chain all along, right? So this once again says that these individuals are at increased risk for cardiac ailments. Anybody able to see? Yeah? Fine? Clear? In this line, if you are able to see that these lines are kind of interspersed, locked, like rice-like structures. Fine. So, if these lines, if these chain-like things are kind of present all along for the entire line, it simply says that it is kind of more severe. Fine? Clear? Then you may also see patients who are having lines all over in the palm, right? Yeah, lines to be present all over in the palm. These people have the tendency to overthink. These people have a tendency to overthink. Works? Right. And there will be few people who won't have these lines to be prominently seen at all, very thin, right? Do we have some? So this is a sign of a weak constitution. This is a sign of a weak constitution. And in some people who complain of having headaches after talking in phones, telephone, mobile phones for a long time, or feeling irritated, or some people might complain like they have suddenly lost their sleep. You have to also ask a question if they have put Wi-Fi recently in their house, right? Because this electromagnetic field interferes with few people's sleep. So in these people, if you are able to see just below the ring finger, in this region you will be able to see a kind of a U-shaped kind of a marking. So these people are kind of having allergy to EMF radiation. As simple as that. And these people will be kind of more sensitive emotionally as well. Yeah. As I said before, if you are able to see veins to be present in the fingers, it means that the peripheral circulation is hampered, and these are candidates more prone to developing cancer. Yeah. So we are going beyond time, I believe. So maybe then 5 minutes, okay. Okay. So we are just starting with auricular diagnosis now. So we have 2 more to go. But anyways, I will rush through. Fine. So yeah, these images we have taken from a different lecture. So whenever you are looking at the ear, if you see this portion of the ear to be kind of flat, then simply means these individuals have got a flattened colon. They may be having constipation, or they may have frequent diarrhea. And in some people you can see this area to be kind of very narrow, very, right? So this indicates that these people have a narrow colon, which means their ability to digest food will be kind of less. They might have a slow transit constipation type personality. So any food which is kind of very difficult to digest, these people will have to usually avoid. right? So if you are able to see this kind of wrinkles to be present in front of this tragus, this indicates difficulty to fall asleep, right? If you are able to see wrinkles here in front of the tragus, this you can see in people who are in old age, right? So if you are able to see, this indicates difficulty to fall asleep. If you are able to see a kind of a line that goes here like this, right? So it's not so very clear in the image, right? So if it is like 45 degrees from here, so this indicates a difficulty in hearing or tinnitus, right? So if you are able to see a deep line like this, if it is a line which goes like 45 degrees, it is to do with hearing. If it is a deep line which comes like this, it indicates CVD, cardiovascular disorder, greater risk to develop angina. And yeah, this crest that we see here is commonly referred to as intelligence crest, right? But it is not true most of the times, right? Right? So if this crest is kind of very pointed, right? One school of auricular diagnosis, they say that these individuals tend to be more intelligent, but most of the conditions it's not true. I'm saying the other ways. Even with people who are having not too sharp this area projection, they tend to elicit intelligence better as well. So if you are able to see a small protrusion to be present below at this area, this can be seen in individuals with hernia. And if you are able to see a kind of black heads in the kidney area of the ear, sign of a renal calculi. Yeah, sign of intelligence, I said this. So yeah, so if one thing that you can see is that if this intelligence crest is very sharp, these individuals tend to be perfectionists. They want everything to be kind of perfect. They want things to be done the same way, right? And you can easily detect hypothyroidism and hyperthyroidism as well. If this area here, if it is red, right, in the thoracic area, it is hyperthyroidism. If it is kind of brown in this area, it is hypothyroidism. Okay. So you can even detect pain in the neck, pain in the low back. See, if this area is deviated, if this area is having a blood vessel to be present, right? So just image holographic theory. Your head comes your neck, upper back, lower back, right? So if you see a deviation or a blood vessel to be present here, neck pain. If it is present here, it is back pain. Right? So if an individual has allergy, one of the easiest way to treat allergy in case of individuals who have urticaria, right? Urticaria, how do we manage? If you want it to be settled down immediately, even in psoriasis patients it works, just bleed the apex. Bleed the apex. Take a lancet, just puncture it, leave it. You will be getting, like a small puncture is sufficient to kind of elicit like at least half a ml to 1 ml of blood. A small puncture. So once this blood flow stops, the person, I am very certain that they will be relieved of their itching right away. Okay? And this effect will last at least for 3 days to 7 days in my experience. So how frequently should we do bloodletting? Once in a week or once in 10 days? Yeah. Yeah. So if you are able to see any kind of desquamation present here in this triangular fossa, it basically indicates some kind of fungal infection to be present, right? And yeah, so once again, this is a kind of a example of blood vessel to be present in the sacroiliac region. So not necessary to do bloodletting here. You can do bloodletting here as well. Even in case of back pain, you can do bloodletting here, and even you can just turn your ear and you can see here. Here also, if in patients who are having back pain, just posterior to it, you will be able to see blood vessels. If you just do bloodletting, back pain will be gone. In case of pregnancy, we shouldn't be doing it. Yeah, auricular diagnosis. But auricular diagnosis in itself is a very huge topic to cover. Yeah, so maybe you can have a reference image, so where these areas are kind of represented, each zone, right? So whenever you're looking at each area like this, if I'm looking at this area, you will be having image of, imaging will be made, like for the entire respiratory system, all the entire respiratory tract will be imaged here all along this area. So you need to be very precise in identifying which area is affected, and you need to do acupuncture. So there are alternative strategies to detect the points effectively as well by measuring the resistance. Lesser the resistance, right, they will be applying a minute current, right, minute current, and they will be assessing the resistance, like the same way how we assess the galvanic skin resistance, right? So lesser the resistance, greater the conductivity, it simply means that particular area is affected. You would have heard about acupuncture point detectors, right? So you place on the acupuncture points, when you are placing it appropriately, then the light glows and you will be having a beep sound. Similar to that, you have auricular point detectors as well, but one difference is that it will be having a probe which is very pointed. You will be putting the probe at different sites to identify the site, and you will be giving the needle. So, yeah, a tongue diagnosis. This is a huge area to cover. So basically, I'll just say this basic information about tongue diagnosis. Whenever you're looking at the tongue, there are 8 things that you need to differentiate. One is whether it is a sign of cold or hot, which is affected, whether it is yin or yang, is it deficiency or excess, or is it interior pathology or exterior pathology. These are the 8 things that you need to differentiate. Based upon these 8 things, you have different permutation combinations, right? So based upon this combination, you will be able to say where the pathology is, whether it is progressing, whether the patient is in healing crisis, whether it is acute or chronic. As simple as that, right? So we have tabulated, it is self-explanatory. So once again, in the tongue, you can kind of differentiate based upon the jiao, right? Upper burner, so basically you have your heart and lung to be present. Heart is present in the tip, just behind the heart is the lung. And when you look at the mid area, it is the stomach and spleen. But clinically, when you are seeing, the inner round will be stomach and the outer area will be spleen. That is how it kind of translates when you are looking at the signs in the clinic. And liver, gallbladder, both of it will be seen on the sides. So whenever an individual is having teeth marks in the sides, you can always say that this individual is having excessive heat, something to do with the liver and gallbladder. And you have all other organs which is present here, right? So, yeah. So interior and exterior. So if you see the periphery to be having a white coat, the interior area to be having an yellow coat, it means the disease is kind of becoming chronic. And if it is reversed, interior area is becoming white and thin coat, exterior area is becoming like yellow, once again I think the disease is in healing crisis. This is one simple example that you can always adopt. Yeah, so based upon the condition, we can differentiate interior, exterior, cold, hot, excess, deficiency, and then you can differentiate based upon the sign, whether it is red, blue, pale, right? And yeah, so based upon the body of the tongue, right? So whenever you're looking at the body of the tongue, right, identifying the color of the body of the tongue is very, very vital. Right? If you are unable to detect the color of the body of the tongue because of coating to be present, you can always ask your patient to lift the tongue up and you can identify the color of the body of the tongue. And sometimes, especially in patients who have developed aphasia following a cerebrovascular accident, you can see dark blood vessels to be present below the tongue in the sublingual area. So what can you do? You can just let it, or you can just do an acupuncture, stimulate and needle it. Don't do it without seeing it once at least, right? So you will be able to kind of help these patients to gain their, yeah, fine. Yeah, so I'll finish with this. These are something which I think will be kind of very interesting, at least in clinical practice. I believe you would have heard about identifying hypertension or any other pathology for that matter using pulse diagnosis. There are some extra pulses basically. So one is called as Shaoyin elbow pulse. So whenever you are measuring, there will be some conditions where your patient will have high blood pressure when you are measuring with sphygmomanometer, and when you are looking at the pulse, all the pulse will be weak. So what do? We kind of give them some aspects to tonify them. right? So, but that is contraindicated. So, in such conditions, we need to identify right, the cause. So, what do? We kind of put the thumb here, right, just above this crease, and just give a firm pressure. In people who are hypertensive, you should be able to feel a pulse, right? Even if your radial pulse is weak, despite having elevated blood pressure, if you are going to select your acupuncture points based upon pulse diagnosis, this matters. Otherwise, forget it. Right? So, if you feel your pulse to be kind of weak, but in sphygmomanometer, when you're measuring the blood pressure, if the blood pressure is elevated, so there will be a confusion. What should I do? My pulse is kind of deficient. Should I plan my points based upon my pulse or based upon the blood pressure readings that I get? You can always look at this Shaoyin elbow pulse. Right? So, yeah, I missed mentioning this. So, what do? If you are able to feel this pulse, your first target with respect to therapeutic aspects will be to improve circulation. Right? So, the other one is like hormonal pulse. So, most of the times we kind of look at the radial pulse. This is what we do. Try feeling this. Look at the ulnar region, just below this tendon, place your fingers. Are you able to feel a pulse? Yeah? Are you able to feel a pulse? Have you ever tried this? Are you able to feel a pulse? Yes, no? Yes? Yeah? So, this pulse is called as a hormonal pulse, right? So, in men, once again right side, in women, once again left side, right? So, in right side, so you can simply categorize it to be 3 types, right? One, if it is excess, these people will have excessive libido, and males, right? So, if it is present but it is kind of not strong, it is normal. It has to be present. Having this pulse is normal. Not having is not normal, right? So, if it is kind of weak, it means kidney iron deficiency. So, your treatment has to be according to this. And in case of women, so this basically gives information about estrogen, and in case of men, it gives information about testosterone. So, excess indicates excessive testosterone, excess in women indicates excessive estrogen. Once again, you can have your inference with your pathologies according to this. So, excess, once again, greater libido. If it is present but not strong, is normal. If it is weak, kidney iron deficiency. As simple as that, right? So, if you are able to feel, if you are able to see in male with more of excessive left pulse, it simply means these individuals are having more of estrogen. In infertility, you can have a right away access, right? So, infertility, so before you can just feel this pulse and you can say probably this male is having more of estrogen, some hormonal imbalance. Maybe you can advise appropriate tests for this individual. And in case of female, right? So, if they have right heart 7 pulse to be more predominant excessive testosterone. So, these are the ones who are kind of very bossy. I shouldn't say this, but yeah. So, coming to the conclusion, half of the problem in our treatment is solved when you are ending up with the right diagnosis. So, this diagnosis alone is not sufficient. You need to have appropriate treatment strategy. So, once you are able to diagnose appropriately, you should know how to treat each of this appropriately. So, then we become a good clinician. So, yeah, I will leave this. So, once again, how do we achieve this expertise? Abhyasa, we have it in yoga. Abhyasa vairagya abhyam thanirodhaka. So, consistent practice, right? So, yeah, thank you. Any doubts if you have? Maybe we'll take for 2 or 3 minutes. I'm sorry, I've taken most of your lunch break. I'm sorry for that. Yeah.
Says.
No, I mean, it's up to us. It's up to us. There is no hard and fast rules basically. So if you're seeing the colors, you can always integrate it. So here we have made it to be forearm, palm, everything together. And one another thing which I missed mentioning, as you said about nails, if you're able to see a depression here along the triple warmer meridian, across triple warmer 2, 3, in this area, these individuals are more prone to have low back pain or sciatic pain. Yeah.
Hello sir, most of the images what you showed they're all very white-skinned people.
In Indian population, it is kind of little difficult, but in the palm, it is kind of easy to identify. We have that challenge. In fact, in one of the slides, I had mentioned that it is difficult to identify in Indian population, but with respect to palm signs, they are relatively easy. Palm signs, it is relatively easy, unless this individual is known to have heavy labor where this palm skin has become very thick, then it is kind of difficult. Otherwise, it is fairly easy. We employ it in the clinic.
So the question is, clinically, how do you find these all things useful in your practice?
In my practice, initially, this will be very helpful to kind of convince your patient. Yeah. Because this does not give you a kind of a clear diagnosis. This basically gives you indication where the problem is. This alone is not sufficient. You need to corroborate this information with your pulse diagnosis, your tongue diagnosis, your iris diagnosis, and then maybe you can present a bigger picture. I think you need to correlate each of this with the pulse diagnosis, with the iris diagnosis. Even afternoon's elemental diagnosis, I believe Madam's lecture will be kind of playing a bigger role to kind of understand this perspective from a...
Icing on the top.
Yeah.
See, basically, I would like to say one thing. As you have seen now, what exactly he said, it helps in diagnosing. Now, when diagnosing, initially, don't be too excited. When you see a vein, you say that you are going to have a heart attack, you are going to have a paralysis. This is not what diagnosis when he says. Okay, it basically tries to give you, tell them you may have some circulatory issues.
Yeah.
So first, calm down yourself. Don't be too excited, because these are the mistakes which start happening. Initially, when you know, see, you become an astrologer the moment you learn iridognosis a little and palmar diagnosis. You can start really mesmerizing people with your knowledge or with the kind of a skill what you have. Utilize that skill first to attract the patient towards you, or convincing him into the naturopathy system, telling that, wow, by just seeing the hand, can you do this? Can you diagnose all my issues? Yes, we can try. As I said, don't be too specific. Don't tell them particular disease name and then try to convince them. Just be on a safer side always. Then over a period, experience will gain you. And believe me, the number of iris photographs, what I have seen in you, the kind of changes at the kind of number of lacunae, even in my clinic I haven't come across so many. I mean, there are so many variety of pictures you could click just in this room. Same way from what you said, the veins and this thing, if you want during lunchtime, take time just to observe 10 different palms. Every palm will give you completely a different picture, a complete this thing. So just start observation. That is where first we should start strengthening ourselves. For you, because you see only your palm or the next person palm, it looks almost the same. It doesn't give you much of an inference. But 10 different palms, just now you observe, every palm will tell you a different story. Okay, so start getting your inquisitiveness, trigger it first. The purpose of NAN giving this is, many of you it looks very new and absurd initially. Can this be done? Why this is not being done by everyone then? It's too simple. That's the reason no one wants it. And if you can just give an inference, maybe you are not able to charge much. But at the same time, look at the astrologers. Once you are confident the way you are able to tell, the more accurate your diagnosis starts becoming. Maybe just for one palmar diagnosis, you can charge 2,000 to 5,000, people will be ready to pay. Because that's what the skill you need to develop. Same with the iris chart. Iris charts, I mean, just I'm taking 1 minute. Okay. Iris chart, I didn't know how to, where to use it, frankly. I was thinking it's only for my clinic, my patients who come in, I just used to observe, take a picture, just tell them 2 or 3 lines and just keep it for myself. I got a person who was very interested, one other patient only. Okay, of course, now he has become, I mean, after doing double degree, he's at around 35 or 40 years now. He joined BNYS with a kind of inquisitiveness what he developed. Do you know what he did? He asked me to get one instrument. He said, I asked him, what interest you have? No, I just want to keep looking for iris. I only ordered from China. I got an instrument for him and gave it. He started setting up a camp. 100 rupees for each picture. Okay. Then he started keeping camps where he started 500 rupees where he used to take pictures, start giving a printout of an inference, 500 rupees per person. Every day, 100 people used to come. I mean, he used to go to public grounds or everywhere, just put a small tent or this thing, demo this thing. And the moment you see iris photographs and everything, people would be interested. I want to get my iris checked. Just 500 rupees, so no one bothered. But 100 people he used to cover in a single day. 500 into, I mean, look at the amount, what is getting. And he is not even a doctor. Not even a doctor. And he used to clearly say, only my experience I am giving you, you go and check it with your doctor. So no liability at all in whatever he is giving, but still making money. Right? So try to become entrepreneurs also. You have to find your own ways where, how much you can utilize it and what gain you can get out of it. It's endless. Believe me, if facial diagnosis, palmar diagnosis, I mean, we have a lot of other things. We don't require any other diagnostic, no blood test, nothing is required in many things. Very easily you can identify and you can give prognosis as well as treatment. And that's the power of naturopathy. Thank you.
Any questions?
So, thank you.
Okay, thank you, sir. It was a very interesting hands-on training session, actually. Sir, now I request Dr. Madan Kumar to hand over the memento as a token of gratitude to Dr. B. Raghavendra Swami. Thank you, sir. Our afternoon session started sharp 1:45. Please have your lunch and come soon. And participants, those who are not signed your registration form, please visit the registration counter. Okay.
The Islamic Academy of Education was established in 1991 by Mr. Yenapoya Abdullah Kunhi, an entrepreneur philanthropist, with a vision to provide quality higher education. As a non-profit trust, the Academy established Yenapoya Dental College in 1992 and set up medical, nursing and physiotherapy colleges subsequently. Over the years, institutions developed by this trust have created a niche in healthcare education, not only in hinterland of Mangalore, but also across the globe. In recognition for this contribution to the education system, in the year 2008, the Ministry of Human Resource Development, on the recommendation of the University Grants Commission, conferred the deemed to be university status. Yenapoya University thus became the first unaided deemed university to be established in the Dakshina Kannada district of Karnataka. The university, following the accreditation in 2015 by the National Accreditation and Assessment Council with an A grade, has diversified its academic prowess and scope by establishing Yenapoya Pharmacy College and Research Center and Yenapoya Institute of Arts, Science, Commerce and Management in the year 2017, the Yenapoya Ayurveda Medical College and Hospital and the Yenapoya Homeopathy Medical College and Hospital in the year 2018, the Yenapoya Institute of Allied Health Sciences and the Yenapoya College of Naturopathy and Yogic Sciences in the year 2021. Yenapoya University has secured accolades by various national and international certification and accreditation agencies, the significant ones being consistent ranking within 100 by the NIRF for 3 consecutive years. ATL ranking of institutions on innovation achievements by the Ministry of Education on 2 occasions under self-finance or private institutions category as an endorsement for the innovation and entrepreneurship development efforts among students and faculty of the university. The university has also been ranked with 4-star grading in KSURF Young University category in 2019. In recognition of contribution to the new knowledge generation, the university has been ranked among the top 50 institutions in India in the SCI MA Geo Institutions ranking consecutively during the last 2 years. There are multiple faculties of study in the university which are represented by the standalone constituent units. These institutions are spread over a total built area of 144,453.11 square meters to accommodate academic and administrative activities. Curricular diversification has been the focus of the university. It offers more than 100 programs at the undergraduate, postgraduate, super specialty, doctoral and postdoctoral levels. The university has enrolled more than 6,000 undergraduates, 600 postgraduates and doctoral students, complemented by over 500 well-qualified teachers trained in ICT-enabled teaching-learning processes. The classrooms, seminar halls and demonstration rooms are ICT-enabled with Wi-Fi facilities extended to all strategic locations in the campus. The integration of information communication technology in teaching, learning meets innovative educational standards. Self-directed learning is supported through e-resources on the customized learning management system. Choice-based credit system incorporates a wide spectrum of electives in majority of the programs offered. Internships, industry visits, community postings, skill development training and early exposure to research equip the students professionally competent for employment. The mentorship program supports the mentees throughout the duration of the program to enhance learning experience and personal growth. Community-based training is imparted through the urban rural health centers, PHCs, Rural Healthcare and Development Center, and mobile clinics to inculcate social responsiveness. The university library caters to the learning needs of the students and faculty. It has a vast collection of books, manuscripts, ancient books, digital learning resources. The library transactions are fully automated, facilitating accession and lending of books. The digital library, which is available at all the constituent units, helps the students and faculty to access the e-resources. All the academic departmental laboratories are well equipped for providing training. To enhance experiential learning and skill acquisition, the university has created Centers Advanced Surgical and Skill Enhancement Division (ASSEND) and a state-of-the-art advanced comprehensive clinical training and simulation center. These facilities are one of their kinds in the country and provide training support to the students and faculty from other institutions. The examination section is fully automated with an indigenously developed examination management system procedures involved in the pre-examination, examination and post-examination processes. This has enabled to bring in several technological reforms in the examination system, enabling speedy announcement of results. The university has been making constant and concerted efforts to actively engage in research. Research support facilities available in the university include state-of-the-art central research facility with modern equipment for conducting advanced research in emerging areas like microbiomes, cell signaling, nanoscience and microfluidics, stem cell and tissue engineering, systems biology and molecular medicine, omics technologies, bioinformatics and biostatistics supported by highly qualified manpower, funding, informatics tools, Animal House and Ethics Center. The Ethics Center has the unique distinction of imparting NIH USA funded postgraduate academic programs in research ethics. The Center for Nutritional Studies fosters nutrition-related activities in India. The policy and advocacy has led to government's initiative in launching a direct benefit transfer scheme for all TB patients to enable access to a better diet. This center has developed maternal nutrition advocacy, implementation, policy and planning in collaboration with Ministry of Health and Family Welfare, UNICEF, National Center for Excellence and Advanced Research on Diets, Yenapoya Technology Incubator, aimed towards identifying, fostering and mentoring innovators, entrepreneurs in the healthcare innovation process. Recognized by the BIRAC, Yenapoya Technology Foundation supports startups and more than 60 patents have been applied, published or awarded. The university has signed more than 150 MOUs with several national and international institutions of excellence for research, faculty and student exchanges. The 4 hospitals cater to the teaching and training activities of medical, dental, Ayurveda and homeopathic disciplines. In addition, there are yoga, naturopathy and wellness centers provide treatment and training facilities. The Medical College Hospital is NABH accredited with 1,100 beds with the latest facilities for robotic surgery, organ transplantation, 3T MRI, modular operation theatres, ICUs, and emergency services. The diagnostic laboratory is NABL accredited, covering services of biochemistry, microbiology, pathology, and transfusion. The Allamelu Charitable Foundation, supported by Tata Trust in association with the Yennapoya University, is establishing a comprehensive cancer care center. Medical College Hospital provides free food, free and subsidized treatment to all the patients. The hospital has received several awards from government and non-government agencies for its outstanding contribution to public service and workplace safety measures. The university provides equal opportunities to all students, upholding the principles of equity. The observance of cultural fest, religious festivals, NSS activities, and disabled-friendly and barrier-free environment provide the opportunity for students from the diverse background to effortlessly blend with the campus life. The international student cell caters to the needs of overseas students to seamlessly adapt to the campus environment. The Student Council provides a platform to undertake various co- and extracurricular activities. The university provides scholarships, fee waivers, and fee concessions for financially weaker students and promotes gender equity. Career Guidance Cell prepares the students for entrance competitive recruitment examinations. The Placement Cell, in association with Alumni Association, organizes campus placement drives. Students participate in extension and outreach activities through camps, awareness programs, and have adopted several villages for comprehensive healthcare support. The university has created excellent sports and auditoria facilities to support the physical and recreational requirements of the students and faculty. Endurance Zone. The indoor auditorium has a multi-purpose hall, basketball court, shuttle badminton, volleyball, gymnasium, squash court, table tennis, and board games. The outdoor sports facilities include international standard grass soccer ground, cricket practice nets and stadium, kabaddi court, throwball court, and athletic stadium. Foodcraft caters to the food requirements of students, staff, and patients, along with 2 canteens and 15 cafeteria spread across the campuses. The laundry services, laundry line in the university campus has capacity to handle 5 tons of clothes, is a boon for students, staff, and patients. The campus has several environment-friendly operations which include rainwater harvesting, water conservation, waste management, energy conservation, and promotion of alternate energy utilization. As an endorsement for these efforts, the university has been recognized and awarded by prestigious international, national, and state bodies and is amongst the top 400 institutions ranked by Times, the Global Impact Ranking, which mainly focuses on achieving sustainable development goals. The university has adopted multiple UGC programs to sensitize and inculcate social responsiveness among the students and cross-cutting issues like gender, environment sustainability, human values, health determinants, right to health issues, emerging demographic changes, and professional ethics. Commitment to our nation and society is embodied in telemedicine initiatives, relief activities during environmental disasters and the COVID-19 pandemic outbreak, and support to cleanliness initiatives of the Government of India. Yennapoya, deemed to be university, provides an inimitable milieu for holistic growth and upholds all functional integrity of a markedly progressive institution. The accreditations and laudable transformations in its overall performances over the years are ample evidence of Yanapoya's contribution to education. Through its futuristic vision, it intends to transform into one of the acclaimed educational institution. The strategic plan Yen Vision 2035 emphasizes on the goals to reach the forefront of academic excellence and to be among the top-ranked universities globally.
Welcome back. We'll begin the session shortly.
A very good afternoon to everyone. Dr. B.S. Nivita is a Chief Medical Officer at Padma Swarup Surya Naturopathy and Yoga Hospital and Divya Bharati Naturopathy and Yogic Hospital. She has completed her BNYS from Tamil Nadu, Dr. MGR Medical University, Chennai, Tamil Nadu, in the year of 2003. She has completed Yoga Therapy Orientation course for medical practitioner from SOSI University, Bangalore, in the year of 2002. She has 19 years of rich experience and 2 years of teaching experience. She has conducted naturopathy and therapeutic yoga course for medical professionals in the Integral Yoga Institute, Caraboba, Brazil, in 2016. She is also an invitee for International Conference on Ayurveda, Naturopathy and Yoga in Cuba in the year of 2019. I request Dr. Padmashri to florally welcome ma'am.
Thank you. Good afternoon. Thank you.
Thank you, ma'am. Today, she will be sharing her knowledge and experience about elemental diagnosis. Over to you, ma'am.
Shall we start with small prayer? Sit straight. Eyes closed. Sit straight. Take deep breathing. Observe your breathing. Try to take deep, long breath in and breathe out completely. Observe the expansion and contraction. Let this session gives you an overall introduction about 5 elements. Let this knowledge helps in your diagnosis and treating the patient in holistic way. I wish all the young buds to have a very successful and contributing life to the society. Let us start with Om chanting 3 times and Vedic mantra Asatoma. Inhale deeply and chant Om. Om. Sato ma sadgamaya tamaso ma jyotirgamaya mridyorma mritam kamaya. Om shanti shanti shanti. Thank you. Open your eyes. Very warm good afternoon. We had a very wonderful lunch. And I thank NIN and Enopaya Institute for organizing this wonderful platform. First, I will give my pranam to all the gurus, Almighty, and my special mentor, Dr. Himeshwari ma'am, who guided me in this 5-element diagnosis. So first, I will start with my experience. Actually, this came out with my 20 years of experience. So I'll narrate one incident, what made me to more interested, and it made me the responsibility in the society for naturopaths. So first I'll start with the history. A young 7-year-old guy, he came with parents, and the parents, they told he has a liver imbalance. The doctors insisted to go for transplantation. It is a liver failure. It is a chronic liver failure. So doctors suggested to go for transplantation. So we usually used to ask the history. Then asked when it started. So they told it was the symptoms were previously almost 8-9 months back. They went to a marriage function. So he had at the evening time, the party time. So he had a mushroom biryani. So he likes mushroom biryani so much. So the parents, the mother, father, everyone, they picked the mushrooms and he gave to the boy. So he had a very fast eating without any proper chewing he had. At the end of the dinner, he felt the burning sensation. So immediately they told, okay, we will have ice creams, we can have the ice cream. Still the burning is not settled. Again, he went to have a fruits, still it is not settled. Within 15 to 20 minutes, he started vomiting. So after the small journey, so they had more than 5 or 6 times he had a vomiting. Then they took to an allopathic doctor. Allopathic doctor, he gave antiemetics. The vomiting was settled. After 3 days, he had a very strong colic pain followed with green stools. Again they went to hospital, they settled with some drugs, it was settled. After a month, again he started severe fever with shivers and very strong cough, cold, everything, all the acute symptoms. Again they gave the IV, settled. After a month, the same pain and everything was repeated, again they settled with the allopathic drugs. So it was almost every month he had the same type of pain and fever, settled with the chemicals. At the 1 year of time, they went for the sonogram and all the master health checkup. They find it is a chronic liver failure. So the doctor suggested no other go, we have to transplant. So for that it need maybe more than 4 lakhs to 5 lakhs. So they have to arrange for it. So at that time they came to our hospital. Then we asked these all things and I explained. So this has happened because of the 8 months back you had a mushroom biryani. It was not properly digested. First we have to remove it. So we have to do detoxification. But they were not interested because the doctor is advised, they brainwashed, no more fever or loose stools or vomiting. So you have to take care of your children. He should not get again one more time fever or nothing. So they told doctor, we don't want any these type of things. We need some kashayams or some medicines or anything. If you suggest, it will be good enough. Then I told no, the problem is it is within the toxicated kalan mushroom is there inside. So better you have to remove, otherwise no other go. Then they told no, we are not interested. They went to another one person. Usually in our village side, any liver related issues, they used to give some herbal things. So they gave that herbal some decoction or something, but they didn't explain anything, the consequences. After the taking of the medicine, he had more than 6 to 7 times of vomiting, 8-9 times of loose stools, but every loose stools followed, he felt very comfortable, he is very energetic. But the people around their house, they told better we have to take hospital because it is too many times. They took to hospital, but the hospital immediately they scolded like anything and they told you don't have any sense or what, they scolded everything and they put him in ICU and within a day they came and told all the organs are failed, so no other hope, we have to do dialysis, so many other things. Within a day he passed, they gave the packet, postmortem, everything they gave. So here I find the problem is where it started. First is mushroom, prior to it, the ignorance of the parents, right? How much he can digest, whether can we give the mushroom in the night or if it is a burning sensation, can we supplement with ice cream? So these things and all, it made me very, I feel very bad. So first we have to create awareness. Then I started taking a case histories in a detailed case histories. Among them, I have so many experiences. As a whole, I am giving you in a nutshell. So I'll show you certain testimonials, how we treated pre and post. So first, everything what I made is the background of all the practices is only our primary concepts. I think everyone know what is the primary principles of naturopathy. First one, body has its own recuperative power. How it can be explained to the patients? We are telling body has its own recuperative power, but still I am having a diabetes, still I have a liver issues, how I can believe it? So I used to give I used to explain. So it's not working. Second one. Okay. So first I used to explain with this. Everyone knows this embryology, right? So it's starting from the single cell, right? From the single cell to more than trillion cell structures, it doesn't need any inputs. It is creating its own way without anybody's help, without help of a mother, without help of the nurse or medical, nothing. So not only human being, even in any creatures, they are creating their own body. So it has auto creating power. So the self creating powerful, a human being can self recuperative also. So with the same concept, I treated almost all type of cases without any use of any herbs or any other drugs. So this one, another concept also, you know, the body has its own recuperative power. All the healing crisis or eliminative process. If you suppress the healing crisis, it will end with the chronic cases. What happened is they suppress the healing crisis, they suppress the vomiting, they suppress the loose stools, they suppress the fever, ended with chronic liver failure. So first we have to clean the detox. The same concept I utilized for all these cases. You can have a view. So this is a thermal injury. They suggested to go for amputation. So almost within 2 months, we able to feel the recovery. So finally, almost it happened in May. In 6 months, it's completely healed. So this is a alcoholic patient. You can see the sore wound. Almost more than 4 months it was there. Again, they suggested to, actually already they amputated one toe, second toe. They suggested to go for amputation from the knees. So these conditions we treated for more than 2 months with our pure naturopathic concepts. It's healed. This is a case they suggested for surgery. Again, it happened within 1 month, it is healed. So all these things in later, at the end of the session, how I treated, how I diagnosed, this we are going to discuss. But just to make your confidence level, I am showing this first. So this is, you can see the varicose vein. So after almost 12th day of our natural therapies, you can see the change. So cracked heel, almost again 2-3 years they are suffering these things, but many other creams and so many other therapeutic modalities they tried, but it healed within almost 15 days. It's healed. Another case. So here you can see the psoriasis. It's the same picture of his legs. Again, one more psoriasis case. You can see the color change. Psoriasis. Why I am showing these all psoriasis? These are I can picturize you. So other cases I can show HbA1c changes in diabetes and cholesterol. It's a normal, the cholesterol lipid profile, there's a changes. So many other clinical things also we happen. We can compare it with laboratory documents. But here I am showing you because you can visualize it easily. So I am showing only these things. So here this is a carcinoma. Actually they told them to go for chemotherapy. It's a 3rd stage. You can see almost within 3 weeks of program, you can see the change. It's a breast cancer. Actually there is a bleeding. Then it is a 15 days, still the patient is in our hospital. So here I want to ensure these all things happen with the proper diagnosis. When we diagnose in a right way, easily we can handle. We doesn't require any chemical drugs or any other even herbal kashayams or any other homeopathic drugs, nothing. Only with aligning with your body with the nature we can do it. Why? How this aligning helps? First we have to understand what is our body. Can you say our body is made up of? Everyone knows. Panchamahabhutas. Where is it? Everyone knows Panchamahabhuta. Our body is made up of Panchamahabhutas. Where is earth element? Where it is? Can you say where it is in earth element is where? Bones are muscles. Happy. And water? Blood and lymph. Okay. Air? Okay. Space? Mind? It's okay. Anything else, please? Backbenches? Anything else? If you want to share also, you can try. Any cavities? It's okay. Water? Water I'll dissolve. Fire? Stomach. Only there? Earth is only in the bone?
Everything is there everywhere. How can it be only?
Yeah, that's what I'm asking. My question is only that. Water is it only in the blood and lymph? Air is only in the lungs? Or fire is only in the stomach? That is my question. I am expecting only that. So let us see where it is. Okay, we know all the systems, no? Our body is made up of so many systems as per modern views. Skeletal system, respiratory system. We can know all the other systems, every system. Every system is made up of organs. Organs are made up of tissues. Tissues are made up of cells. Now let me show you what is the cells. Okay, sorry. So this one we know, right? So this is cells. So in that, so every cell have a nucleus, right? Every nucleus is made up of DNA. What is DNA? Is a magnetic strands. So all the MRI scans we are taking out from the resonance of DNA. Am I right or wrong? So each and every cell have a magnetic force. So each and every cell have a earth element. Actually earth is a very big magnet. So every cell is having the earth element. The same way. Every cell has a cytoplasm, intracellular fluid. So every cell is having a water element, right? Every cell has a mitochondria. So mitochondria is the powerhouse of the cells. So whatever the food we eat, it is stored in the ATP, adenosine triphosphate. When it is burning with oxygen, we are a aerobic metabolism. So when it's burning with the oxygen, it gives the energy. So it is a energy store. So the energy is a fire element. So each and every cell have a fire. So the fire has to come up with the inhalation of the oxygen. So air is there. So air element is there. So to entrance of the air, it needs some space. So for the space, we have a lysosomes, suicidal bags. It is empty bags. So all the 5 elements are in the cells or not? So now can you clear with this? So earth element is not in the only in the bone. Water is not only in the blood. Air is not only in the air. So all these cells, each and every cell, more than 120 trillion cells are there in our body. So each and every cell is made up of 5 elements. Every cell is a single unit. Everything is a viable of how we are having a life force. The same way each and every cell has a life force. The sum of all the cells life energy, we call it as a vitality. Is it clear? Can we make it as a naturopathic anatomy? Is it okay? Okay, now we'll move to when there is any distress. How if it is any distress in the nature. Example, we are putting more the bore wells. So there is a internal, there is a below to the, there is an underground, there is a distress. It comes as a cyclone. So if we create any pollution to the air, it comes as a cyclones. If we pollute to the sea, it comes as a tsunami. So it happens, nature has its own recuperative power by creating the disasters. The same way in our body, inner equilibrium is disturbed, our body creates as a disease. Is it okay? So because since it is a nature, so our body is a nature, so when whatever it is happen in the universe, it will happen in the our body also. So okay. So now I am moving to nature. Why I am telling these things is, before coming for diagnosis, we have to little bit clear about anatomy and physiology and pathology in the view of naturopathy. Here I will ask you one question. Is it necessary to have our own diagnostic tools? We think our all allopathic tools are very specific, very advanced. Then what is the need of naturopathic tools? We have very good blood test reports. We have anatomy, lab reports, ultrasonogram, MRI. Then what is the purpose of these things? First I thought of asking you, why we need? We think it may be superficial or it may not be very accurate where we are going to apply it. Am I right? Whatever we learn, again we are going to see the report, then only we are going to treat. Okay. By knowing the root cause. Okay, anything else?
Modern diagnostics do not tell some entities like
Very happy.
That's why we need these diagnostic practices.
So, okay, very, very happy. Have you seen all the diagnostic, as she told, all the laboratory or any sonogram reports, everything, they say about the dead body's result, right? Only the physical body's report, not the energy report. Actually, example, if you take my body, if my heart, if you ask my heart, what is the source for the functioning of the heart, it is energy. Any allopathic laboratory test, can you show the root cause of, that means the functioning, that is a functioning force test, anything can they show? My heart is functioning because of the energy. Anywhere can they demonstrate? Only they can demonstrate the muscle, or they can demonstrate the blood which is already taken away. Again it is a dead. So all the reports are shown only the dead body reports. So our body is a live body. So we need life energy. Actually another one more thing I can tell you. My body is activated by the life force. So if any problem in my liver, it means the life force to the liver is insufficient or congested. So first I have to treat the life force, not the organ. The root cause for the disease, as she told, the root cause for the disease is the energy. So for understanding the energy, we need our own the tools, that is all the other iris diagnosis, all these things are telling about the energy level. So our 5 elements also we are talking more about the energy level. So first thing we are understanding the physical body. Now I am going to moving towards the energy. So now I can say this is a naturopathic physiology. Okay, our body, we know our body is activated by the vital force. So what is vital force? What is vitality or immunity? Can anyone say vitality means what? Okay, it's a post lunch, I will tell. So the vitality we can say it is a 2 types, innate vitality and acquired vitality. Innate vitality, it is coming from the parents. The first one is gametes, the sperm and the egg. And another, after formation of the zygote, then it will be implanted in the uterus. After the implanting, this will be maintained by the maternal health during antenatal period. So how the mother is taking care of her food or exposure to the 5 elements, based on that the baby growth will be there. So based on that. And acquired immunity, that means the lifestyle, how much we are exposed to 5 elements, how we are thinking process, based on that acquired vitality will be there. So these things we can compare it with our property. So how much property our parents give, how much property we develop. So both the things matters. So the same way here also. So the health of the baby is depend upon, it is because of their parents and also their lifestyle. So I can hear the innate capacity, I can say it's a comparing with the manufacturing defect, and this one is acquiring defect, maintenance defect. If any vehicle if you take, it is a manufacturing defect, it is a maintenance defect. So if manufacturing is a defect, then we have a limitation. But if there is a problem with the maintenance, we can easily handle them. So while diagnosing it, first we have to separate it, whether it is innate or it is acquired. So the first hand diagnosis we can do that one. So this, everyone know these things? What is it? Can you identify what it is? It is a Chidambaram temple. So once the life force is there, so I will tell you what is the connection with this. Example, if you are this electrical bulb or fan or some, everything is, it is visible. This visibility can happen through invisible electricity. Am I right? Sthulam is a Sukshma. So this Sthula body is activated because of the Sukshma body. So these things coming through the wires, right? The electricity is passing through the wires. But the same way in our body, the vitality is passing through the invisible channels. That channel we call it nadis. Okay. So in our body, in Granda Samhita, other textbooks also we mentioned, in our body there is a 72,000 nadis are there. These 72,000 nadis, it is mentioned in our Chidambaram, in Tamil Nadu, one temple is there. That temple we call it as the Akash temple, Sidambaram. Many people know Sidambaram Rahashyam. So Sidambaram Rahashyam, the secret of Sidambaram temple is it's connecting with the human body. So everything is secret. So here there is a 72,000 nails representing our nadis. These, that is the roof, it is made out of gold sheets. There is a 21,600 sheets are there. It is connected with the 72,000 nadis. Why 21,600? Any idea? Excellent, very good, very happy. Per minute, how many times we are breathing? Per minute, 15 to 6, almost 15. Average we can take 12 to 16. We can, as average, we can take it 15 times. Per hour, 15 into 60. Per day, 15 into 60 into 24 is equal to 21,600 times. So all our nadis are connected through our breathing. So okay, this is represented in this Chidambaram temple. So again, these nadis are, we can compare it with we can connect with the meridians, because our science last Sridhar sir, it is in the last session he mentioned these nadis, this knowledge is given to the China, they refined it and they are calling it a meridians, but almost it's the same, certain things little bit difference will be there. He can compare it with meridians also. So all these meridians, we have so many meridians. How many meridians dominantly we are using is 12 meridians plus 2 meridians, governing and due meridians. So totally 14 meridians. Here I am mentioning one meridian here. These meridians are the pathways which gives energize the particular organ. Okay. So these meridians are energizing the particular. Here this is a kidney meridian, urinary. It is a urinary bladder meridian, and some other meridians also there. So this urinary through this meridian, urinary bladder is energizing. So here the same way we have a lung meridian, large intestine meridian. Among this meridian there is a commanding points. Every meridian have a 5 element points. So that particular point, how we are in a FM radio, 103 means some frequency is matching. Another 98.3 means some energy is matching. The same way, every meridian, it is receiving some energy from the Prapancha, from the universe. So the same way, not only us, even human body, even the plants, even the animals, everything is receiving energy from the macrocosm. So the particular points, we are receiving particular hertz. So that will be energizing the internal organs. So the electromagnetic power which nourishes our body, if there is any block or any deficiency, if it is not entering, then that particular part, that particular organ is defecting. Is it clear? So this energizing process, every day, every day it happening. So 12 meridians, they are energizing for 2 hours. So this will be useful for diagnosing in later, I will tell you. So this is called, we call it as a Dega Chakra. In our body, there is a 12 meridians. Every 2 hours, a particular meridian is energizing. Example, morning 3 to 5. So that is the time where the lungs is getting energized. Particularly that time, any asthma patient, they will have a more cough, more vomiting. So during particularly that time. Another way, if some people, if they have any problem during 9 to 11, so that time if they have a problem or pain or some mood swings or imbalance, we can come to know 9 to 11 is the time for spleen. So that time it is a problem means that particular organ is defected. So, okay, so we can use this chart for diagnosing also, or to energize also, for treatment also. During this example, if my stomach is weak, so 7 to 9 I can tell them to go for more earth related things, because 7 to 9 is a earth timing. 7 to 9, so 7 to 9 is a stomach and spleen. So earth element time. So these times I can tell them to go for more earth related things. You can connect with the earth, or you can do some earth treatments, or you can take a earthen pot water or cooking, or these things are earth element meridians. Stomach meridian, we can tell them to go for massaging. So these things we can tell them. If they have a problem with the lungs, so that time we can tell them to go near to the plants, so that the air exchange can happen. So these things we can tell them to strengthen their lungs. So which element is defected, based on that we can identify. At the same time, we can use this chart for treating also, for enhancing their energies. So this is again related with the air element, which the timings, organs. Actually, these we call it as a warm organs. I think this Dr. Kalpana, they took, I think, warm organs, cold organs, organs related with the element. Is it right? If you want, I can refresh once again. Air element means we have two types of, actually we have in last class somebody asked, I have only problem with the left side. During iris diagnosis, I think, right? So this is my interpretation. Sometimes our body is two hemispheres, we can say it is a ha and ta. Right side we can say it is a sun nadi. Left side we can say as a moon nadi. So it is a balance between sun and moon. So all the organs also we can separate in the warm organs and cold organs, or sun organs or moon organs. We can say yin organ, yang organ, hollow organ, solid organ, anything, female organ, male organ. There is so many names we can keep it. But here for air element, it is a large intestine as a hollow organ, lungs is a solid organ, or female organ, male organ. For earth element, it's a spleen is a female organ, it's a stomach is a hollow organ. Solid organ can secrete, hollow organ can receive it. So okay. So like that all other elements also we can see. And now I want to explain about the naturopathy. Now these things we can make it as a naturopathic physiology. So here again, once again, the vitality, how it comes from 5 elements. Again one more questions. How I can ensure my earth element energy? Here can we say this earth, this is also earth. Can we get energy from this thing? So what is the difference between dead earth and live earth? What is the difference between dead air and live air, living air? Any difference? What it is?
Inside the forest, the air will be live.
Inside?
Inside the forest.
Inside the forest. Okay. Can we say this is inside the room AC hall, the air is a good air, lively air? Can you anyone know about the percentage partial pressure of oxygen in this room? There is a normal atmosphere, oxygen level. Air composition. What is the air composition? 21% is oxygen, 78% is nitrogen. Another 1% maybe other gases. So our body's partial pressure also it is a 21%. So if it is a 21% is oxygen, if outside is a 21% is oxygen, there will be a transportation or transformation takes place. But here if it is less than 21%, what will happen? Our oxygen will be going out. We are receiving more carbon dioxide. So at the end of the day you feel more suffocated, more tired, maybe headache, other consequences happens. This is we call it is a not living air. I can say it is a carbon dioxide rich air. The air which gives the prana, which gives the energy, we call it the pranic air. Where we can get it? With the plants. The plant will take away all our carbon dioxide and it gives the oxygen. So here the air energy can be utilized through the plants. Okay, so this is called living air. The same way the earth. If you compare with the earth, this is called dead earth. Can we come out of this tiles or this one? Only the living earth that can produce the plants, that is fruits or flowers or vegetables. So the earth where we are exposed to living earth, there we can enrich our magnetic energy. Am I conveying my message? I don't know. Are you receiving it? So earth element has a magnetic force. So that magnetic force it is not present in the tiles. Is it okay? So where it is available? Only in the outside where the plants are growing. So there if we expose, we can enrich our earth element. So likewise all our air element, earth element, water element. Water element, if you take RO water or boiled water, maybe many in COVID time they suggested to go for, you have to boil it and you have to drink it. So when you boil it, the life force of the water will be lost. So if you take that air, your water energy, the pranic energy of water will be lost. So your kidney energy will be lost. So, okay, so the vitality is coming from the living 5 elements, the pranic 5 elements. Here I am telling about the naturopathic physiology, that acquired energy, it is coming only through the living element, not with a dead element. So as much as we are connected with the natural 5 elements, the natural vitality can be enhanced. But when we expose to the deadly environments, like air is very less, when you take a more RO water, or you are not exposed to the sunlight, or you are not exposed to the moonlight or space, all your 5 elements will be restricted. So when you are exposed more to the unnatural things, your vitality, acquired vitality will be coming down. So you ended with the more diseases or toxications. If you inhale once, the same way you have to exhale the same carbon dioxide. But what the inhalation itself, it is a carbon dioxide, you have to think what will happen to your blood. Am I right? So what you are inhaling, that will become, instead of oxyhemoglobin, your body become carboxyhemoglobin. Your blood will be more acidic. So your blood and lymph will be, abnormality will happen. So that restricts the alveoli. So it happens, your body become more acidic. So the consequences happens. So what we give, the way there is in the lifestyle that we are. So expose more to the natural environment, automatically your body become normal. The vitality will be more. But here when you take the case history, I used to tell them to ask everything. So where they are living, where they are sleeping, so whether they are sleeping in the closed environment or whether they are open environment, how much they are exposed to the moon, how much they are exposed to the sunlight, how much exposed to the earth. So these things, it gives us clues for coming to conclusion whether earth element deficiency or air element deficiency. So, okay. So here in allopathic way, they used to give a report, your liver is damaged or fatty liver, so because of that you have this problem. Here our naturopathic concept is, it is upside down, it is ulta. So here the problem, it starts with the mind. When there is a problem in the mind, that thought process is disturbed, that disturbs in the, first the diseases start with the thought level. When there is a disturbance in the thought level, it disturbs the nadis. There is obstruction and distractions. This leads to physiological change. In this we can say the laboratory change, that maybe the blood count may be changed, or some lipid profile may be changed, creatine may be changed. Then later it will go to the anatomical changes. Here our stages is different. The first stage, it is a thought level, second it is a nadis, third stage is a physiological, fourth is the anatomical. But in allopathy, the first stage is anatomical. First they will say it is a, because of this problem, then there is a different of a liver issue, because of that the lipid profile is changed, then the other changes it comes. So here ours is ulta. So when you come to diagnosing, you have to take it as a consideration for which stage they are, whether they are in the thought level or whether they are in the nadis or they are in the physiological or anatomical. So based on that we have to work. So first here we have to start with the mana, that is a thought level. First we need to give more counseling. First the thought level is cleared, then only we can understand why, because of this every thought has an influence of the 5 element also. That also again we will see. So I think you know about the Panchakoshas, Annamaya Kosha, Pranamaya Kosha, these things. In this we have a Vyadis, 2 types of Vyadis, Adija Vyadi, Anadija Vyadi. Adija means because of the thought process we have a problems. So first we have to understand what are the psychological issues. If they have a stress, it is related with the earth element. If they have an inferiority complex, it is related with the air element. If they have a fear, they have a related with the water element. If they have a irritation, they have a space element. If they have ego, it is a fire element. So which psychological issues, so what element is related? So we have to connect with the psychological issue and also with the element. So I think you know the last class, Kalpana doctor maybe touched about the teeth diagnosis and also the tongue diagnosis. So where it is a problem, and actually doctor also nourished, but because of the time we will go with the other concepts. Here we have a table column. So in this table column we used to write the case history, and this will be given to you also, the case sheets will be given to you. So even for yourself you can take one case sheet. So you can understand which taste you like, which color or which psychological issues. So based on that a person can be diagnosed. Here I will explain you how to take the first case sheets. First here we used to take the primary data, everything you can take it. And another thing is, another one is emotions. First we will start with the emotions. If they have a emotion of overthinking, so you have to mark it. If they have a grief or comparison or complexity or sadness, you have to mark it. So if you have a fear, we have to mark it. So first emotion level we can confirm which element is disturbed. Another thing is which taste they like, because each element have a different characteristics. Earth element has a different exclusive characteristics, so their taste will be sweet. They like more sweet taste, and their colors will be yellow color. They are confined with particular characteristics. They will be obsessive thinking, and they have a sadness. So these things, particular things, it will related with the particular element. And the another thing is the diet habit. If they have a more refined diet, example maida products or these things are related with the earth element. At the same time, if they have a in between tea, coffee or in between snacks, if they are not having a proper chewing, then it is related with the quality of the saliva will be reduced. So we have to understand their habits, their secretions. So example, if they have a poor chewing habit, they will end with the poor saliva. So the saliva, when it is reduced, their acidity will be more. Saliva, it will create alkalinity. So this leads to earth element deficiency. And the timing, if specifically spleen time or stomach time, and unnatural lifestyle, if they are not having exposure to earth, then we can confine earth element energy is low, their magnetism is low. So the same way we can go with the air element, water element, each element we have to go with the detailed discussion and come to know which element is defected. So these are all we can say it is a subjective science. The same way,
How if person is coming to me, how I will differentiate between depression, grief and sadness?
you can ask detailed questions. Example, if they have a uncompensated loss, it can't be compensated, then we can say it is a earth element, it's a uncompensated distress. Grief means they used to compare inferiority or superiority complex, so these things. So we can differentiate by taking the little bit of detailed consultation. It's okay. The another thing is we can have it is not eye color, it is elemental color. The same way we can have a objective science also. So previously what we seen is it is a subjective science. We have to interact and we have to take the answers, then we can come to know it is a subjective science. The another one is objective science. So what color we are observing? Sometimes somewhere yellow color, in eyes yellow color may be there. In what case? In jaundice. Okay, so others white color may be there, some pale white color may be there. So we can say it is a fire element is less, air element is less. Air element is less. Somewhere we can say black marks. In the neck you can see black color, or creases you can say some black patches, or somewhere it is white patches, somewhere it is a red patches. So first we can understand with the colors. So white color means it is a air, red color means fire, green color means space. The plants are at the green, no wood, so it is with a space. Yellow color means it is a earth, blue and black it is a water. So based on the color, even for teeth, if you see, if there is a black color, then we can say it is a water congestion. And the same way, particular governing organs also we can say. Actually, I didn't mention very detailed, but usually in our consultations, we have a governing organs also. Sometimes the governing organ of spleen, earth element will be the muscles. If they have a bulky muscles, we can come to know it is a earth element. If they have a skin issue, the governing organ of air element is a skin. So air problem means it is a, skin problem means it's a air element. The nail or teeth or hair, it is related with the water element. So if it is a pertain to a particular thing, then we can connect with the water element. If it is sometimes a ligament, it is connected with the space element. Blood vessels related with the fire element. So based on the organ also, we can connect with the elements. So these things we can see with the 5 element characteristics. So if you go in detail about the earth element characteristics, water element characteristics, which element, which organ, which governing organ, which season, which emotion, which color, these all will give you a overall picture. So, okay. So sensory organ, the earth element sensory organ is lips. If you see the lip structure and spleen structure will be same. Okay. The same way nose. We have a one, there is a 2 alleys. So this is a 2 lungs. So it is a nose is related with the air element, that is the lungs. Ears is related with the kidney. And eyes related with the liver. Tongue is related with the heart. So all the governing, there is a second sensory organ is related with the elemental organs. I think you might be knowing about the element and organ connection. Okay, you can relate it. And so here I think I mentioned, yeah, muscle governing organ. Sorry. So here I think I mentioned governing organ, muscle, skin, bone, nails, tendons and blood vessels, yes. Then each element have a separate functions also. Example, if the problem is with the example in the diabetes, if there is a transportation problem, sometimes transportation in sense constipation may be there or urine transportation may not be happen. So it is related with earth element. In cases of dispersion, if the condition is the nutrients are not dispersed in the right way, so we can think of air element. Or in sometimes I have one patient, she came with the full of red spots, full of allergic reactions, and they have a very intensive itching. She came, so I asked what is the root cause. They told within 3 hours they went to a bank and the car was parked, new car was parked outside in the sunlight, and after entering into the car they put the AC. Because of that new car, because of the heat, I think the poisonous gas is totally spread in the car which she inhaled, that spread all over the body, that created the toxic air which she inhaled, that created the allergic reaction. The hot air which created the excessive fire element, it is expressed in the skin. So the redness we can understand it is a fire element, where it is expressed in the skin. So the excessive fire in the air element. So here the diagnosis is excessive fire in the air element. The treatment will be again cooling. So when you treat, when you diagnose in a right way, within 3 days she completely normal with the cooling pranayamas and just curd rice and proper mud pot water drinking. So the first we have to understand what is the root cause for the disease. Okay, so for that this detailed history will help you. So the functions of the every element is a transportation, dispersion and reproduction. If they have a fertility issue, we can think of water element. If they have a problem with detoxification or speech or vision, we can think of space element. Again the fire element, circulation, vision and speech. So another thing, another way how we can diagnose is, everyone know the meridian pathways. Maybe in a 3rd year or 4th year you might be studying about the acupuncture, so you will know about the pathways. If they have any pathway corrections, that means obstructions. Example, I can show you example. So this point where it comes, which meridian? Is it small intestine? Is it small intestine? It is a large intestine. Very sorry. It is a large intestine. So okay. So this point is exactly large intestine point. What is the color? Black color. So in large intestine is a young organ of air element. Right? It is a young organ of air element. there is a water congestion in the young element, water congestion in the large intestine, right? It is a congestion. So here we did a detoxification, LSP, Laghu Sangha Prakshalana we gave, and also all the related with the Apanavayu cleansing programs and packs, hip baths, girdle packs, all the detoxification dietary therapies, it healed within a month. It is suggested for the surgery actually. So it is repeatedly it is coming, so they suggested for the surgery. So this is one thing. And another thing I can show you, so this is a breast cancer. It is almost 4th stage, 74 years I think she is. So here you can see the oozing, the wound. So actually now 14th day it is reduced, you can see the covering of the skin covering, it is a healing. Here what we did is, actually it is a stomach meridian. Can you know the nipple, through the nipple the stomach meridian is passing. So we have almost more than 6 cases, all type of the cancers are coming down. So here we gave completely nourishing diet for the stomach and stomach meridian massages and connection with the earth element, that is a barefoot walking. So Bebel walking. So these things 7 to 9 we gave more natural therapies that is related with the earth element. So it is coming down without any application, without any oil thing, nothing. So this is another testimonial. And another thing is, okay, actually 3-4 cases I thought, but they told the time will be very less, so I am confining with 45 minutes my time is, so I couldn't show much of our case histories. But my message to you is, through proper analyzing, case history taking and confidence, you can treat any cases. You can heal even the cancer by giving the name, is a cancer or autoimmune disorder or SLE. By giving this name, don't panic. These names are given by allopathic doctors with their understanding. Our naturopathy is much more easier to understand, much more it is simple to express and easy to cure also. So take it as in a simple way, where it is located, which organ is affected, which element is affected, what is their lifestyle, what psychological issues they have. So try to understand and take it in the root. It is clearly we can have a very good hope, and your confidence also can improve, and also the patient can also, they can survive. If I have one more another experience, a person, he is aged around 35 years, he came with complaint of, it is a I think, I am not very sure the allopathic term. First actually they went with the problem with the shoulder pain. They have a shoulder pain, so they went to the ortho doctor. So they suggested sometimes we have to take a X-ray. In X-ray it was very clear. Then they suggested to go for CT scan. In CT scan they told them some lymphoma is there, so we have to take the biopsy. Then again they went the biopsy. Then they told it may be any bone cancer. So again they took MRI and other studies, T cell studies, many cell studies they did, and they gave the chemotherapy also. Even after all these therapies, their pain was not reduced. They, at last they asked, they came to our hospital, then we had an online consultation only. He was residing in the Chennai. So we came to know they are residing in a closed environment. Closed environment means they don't have a even window at all. They have only AC provisions. So they don't have a fresh air. In working office also they don't have a fresh air. During traveling also in car he used to use AC. So there is no chance for oxygen at all. There is a fresh air at all. They don't have any chance at all for oxygen. So their living environment and working environment, they are more exposed to acidic environment, that is a carbon dioxide. So because of that, there is a lung meridian, it starts from here. So it has a pain over there. The body wants more oxygen, so the meridian is overacting, so he developed pain over the meridian. Then we suggested to go for just you sleep under the tree. Maybe any neem tree or any tree, or go near with the plants and expose yourself more with the nature and more the sunlight and other things. Within a week his pain is gone. But last 1 year they spent more than 11 lakhs with so much pain, so much chemotherapy, so much drugs, they polluted their body, but there is no pain. But simple thing with this just air exposure, it was cleared. So like that, so many problems will be it starts from the simple measures. So try to analyze in a right way with the confidence, you can succeed, it will be need of the society. So our naturopaths, you have a very good future, you can earn economically also more, and also the confidence level also you can create in the society will be very much needed. All the best for your best future, and come with the good naturopaths. Believe in your system, you will succeed. Thank you.
Thank you, ma'am. Now I request Dr. Sunita, Assistant Professor, Department of Nutrition, to hand over the token of gratitude to ma'am. Thank you, ma'am. We will start with the valedictory function soon. Kindly fill the feedback forms.
So, Dr. Niveda ma'am wants to share a case sheet model based on the elemental diagnosis, which she is practicing using in her center, in her hospital, that they will be giving to you. You can make use of that, you can replicate that, okay, and ma'am will be explaining in brief about that.
One case sheet. Got it? Just you can, primary data, so you can write the health seekers detail. You can take any one of your friends' history also, you can take it. If they have any, just again it's an idea. If they have any chief complaint, we can write it, and history of complaint. Got the paper? Oh, you got only feedback. So we have a case sheet paper. You can pass it. They can.
Yeah, take a bunch, you pass to half.
What is it? Thank you. Got it?
One who received, just you read it out.
Did everybody receive the case sheet? Everyone have? Including the feedback form? Feedback form, who all not received yet? Can raise your hands. Yeah, feedback form. I hope everybody received the case sheet, so we'll go on discussing with the case sheet now.
So first we need the primary data, no? So you usually fill that primary data. The next one is chief complaint. What they have a problem at present. So that we'll write the chief complaint. Then history of complaint. How long it is, or it may be associated with other factors, with the severity, timing, and aggravating factor, relieving factor, the site, radiation, associated factor, these things you will be writing in the history. Another thing is past history. Example, maybe they have a past history of fever or cold, cough, or suppressed with some drugs. So that you have to write it. In past history, in naturopathy, we need very important, usually we are not writing it. So we have to write it, the past history, if they have any healing crisis. So sometimes maybe fever or loose stools or anything maybe, vomiting, whether how they managed the symptoms, whether they detoxed or they suppressed with the drugs, maybe it may be Ayurveda drugs or allopathy drugs or homeopathy, anything, how they handled it. So in that we have to write in the past history. Then family history. In family history, if they have any history with the maternal or paternal, or if after married, whether they have experience in the in-laws house. So it may not be related with the genetic, it may be with the familial habits. Maybe cultural habits or family habits also they may developed. So that we have to write in the family history. And the medical history. So what drugs they may having. So they may think if I have a diabetic since 20 years, but I don't have a symptom with the diabetes. I am managing with the drugs. But now I developed a burning sensation. So that means they are suppressing their poor quality sugar with the drugs. So because of that, it's congested in the liver. So they have a burning sensation. So or it may be congested in the another tissues. So for that, we have to write the medical history, how long, what medicine they are taking, at what interval they are taking, frequencies. And vital data, that may be blood sugar or that's a pressure, or these things you can, height, weight, breath hold, timing, these things you can write it. And another thing is elemental, here it is elemental diagnosis, it is objective signs, first actually it is subjective sign. We have to interact with the patient, you have to do the detailed counseling and consultation. Immediately if you ask, do you have any overthinking or anything, they won't say. So you have to take how your psychological thing will be, or how you handle the things, whether you will be irritated or how their mood will be. So these things, you little bit you can expand your discussions, you can come to know the psychological thing. So overthinking or uncompensated loss, all these things you can, emotional well-being, how it is, you can record it. And the taste, what taste they like most. If they have a sweet preference, their earth element will be weak. If they have a more spicy tenderness, there is a tendency, they have a air element weakness. So sometimes they may say, I don't like sour at all. So their space element will be excess. So sometimes they may say, I like so much bitter taste, or I feel bitterness in my mouth. Example, during fever condition, you may experience bitterness. So there will be excessive fire during that time. So the bitterness is because of the excessive fire. So you have to write whether it is aversion or neutral or addiction or the preference. So in the taste wise you can write it. And the diet habit. So whether they have a frequency of refined sugar like barotas or non-maida products, or outside food, or more grain. Actually the people in South India, we prefer more grain diet. Idli dosa in the breakfast and lunch, and the night also same idli dosa. So almost 3 times we have a grain diet. So more grain means there is a more earth element. So they'll have a more fleshy, that is structures will be more flush, more constitution will be there. So for them, there will be excess earth. When the earth is more, their water level will be low. You might be last, Kalpana doctors, yesterday the class will be, I think, taken by Dr. Kalpana. Mother-in-law cycle and daughter-son cycle, husband-wife cycle, these things will be two cycles, the constructive cycle and destructive cycle. So in that, when the earth element is more, automatically the water element will be less. The excessive the water will be absorbed by the earth. So okay. So another thing is, when they have a air element, there's a crispy, if they have a more preference for dry items, crispy items, fibrous or milk, so their chances of mucus production will be more. If they have a crispy things, there is a more chances of dryness. So any refined salt, if they are taking more, or seedless or hybrid, genetically modified, salted, pickled or egg, so these things all related with the water element. So what diet they used to have more, based on that their element defect will be there. And also if they have a more of oil fried or processed food, overcooked or more preservative, more color, fermentation, we can think of space element. So like that, the taste and the process and the choices, we can think of the element, and the timing, which timing they are experiencing. Already we saw the Dega Chakra, so in that, based on the timing, we can think of the element and the organs. And unnatural life exposure. Many people, they used to miss the diet. Morning breakfast they used to miss, or improper timing, or in between beverages. Some people, they used to drink coffee, tea for more than 7 times, 10 times. So their saliva, quality of saliva will be reduced. So the secretion, the secretions of the every element, we have to think of this. Saliva is a secretion of the earth, mucus is a secretion of air. So which secretion is affected, based on that the element we can correlate. So the same thing we already discussed about the objective science. So based on these, it is a simple model format. Even you can include more this elemental base also, then you can conclude along with your case history. So with this, you can have a plan, and based on the elemental correction, and you can correlate the symptoms with the iris, tongue and teeth. So you can combine, and you can come to a holistically also you can diagnose and treat the both the ways. Thank you.
As we have come to the end of this national level workshop on Prakruthi Vijnana, the science of naturopathy diagnosis, the Valedictory program, I request Dr. Shagufta to escort the guest of Valedictory function to the dais. Now, I cordially welcome Dr. Puneet Raghavendra, Principal, Yenapoya Naturopathy and Yogic Science College and Hospital, President of today's Valedictory function. Welcome you, sir. I request Dr. Harsha to florally welcome, sir. I welcome Dr. Ravi, Professor, Department of Internal Medicine, Yenapoya Medical College, our today's guest of honor to the Valedictory function. Welcome you, sir. I request Dr. Puneet Raghavendra to florally welcome, sir. I also would like to welcome Dr. Madan Kumar, Domain Expert, Yoga, NIN Pune, our guest of today's Valedictory function. Welcome you, sir. I request Mr. Ajit to florally welcome sir. Now, I would like to request Dr. Sunita D'Souza, Assistant Professor, Department of Nutrition and Dietetics, to read out the brief report of the workshop.
Prakruthi Vijnana, the science of naturopathic diagnosis, a 2-day national level workshop was conducted on 11th and 12th of March. The workshop was organized by Enapoya Naturopathy Yogic Science College and Hospital in collaboration with National Institute of Naturopathy, Pune, with the aim to create an awareness of the use of different types of diagnostic methods in healthcare profession. NatureCure makes use of easy and efficient natural methods of diagnostic techniques like facial diagnosis, iris diagnosis, tongue and pulse diagnosis, in addition to clinical and physical examination. Hence, the objectives of the workshop were planned to provide hands-on training experience from the subject experts to allow the participant to appreciate the awareness on how naturopathy diagnostic methods help in the clinical practice, to upgrade the evidence-based knowledge of time-tested diagnostic techniques. As a pre-workshop initiative, the workshop brochure was sent to the various naturopathic colleges in India through email. So totally 100 delegates from Kerala, Karnataka, Madhya Pradesh, Gujarat, Tamil Nadu and Delhi have been registered for this workshop. The details of the sessions of day 1. The inaugural session was held at 10 a.m. on 11th. The program was inaugurated by Dr. Satyalakshmi Ma'am, Director, National Institute of Naturopathy, in presence of Honorable Vice Chancellor, Dr. Shripati Rao, Enapoya Deemed to be University, and Dr. Shambhat, Dean, Faculties of Enapoya Dental College, and Dr. Punit Raghavendra, Principal, Enapoya Naturopathy, Yogic Science College and Hospital. Afterward, the first session of national level workshop was started by Dr. Satyalakshmi, Director, NIN, on facial diagnosis. Facial diagnosis, the science of diagnosing the internal condition of the body from the external appearances. She stressed the significance of facial diagnosis, how it is possible to discover the location and amount of foreign matter in the body. The second session was by Dr. M. Kalpana Devi on pulse diagnosis. She gave a hands-on training how pulse diagnosis accurately diagnose physical, mental and emotional imbalances and as well as diseases. The last session of day 1 was on chroma diagnosis by Dr. Punit Raghavendra. He explained and discussed how the colors in the human body maintains the balance and how the subjective and objective observations can be done. The details of the sessions of day 2. The first session was by Dr. Sridhar Pulipati on iris diagnosis. He gave hands-on training about the observation and diagnosis of the disease by examining the iris of the eye. The second session was on acupuncture, palm and tongue diagnosis by Dr. Raghavendra Sami. He provided detailed explanation on how reliable these diagnostic techniques in identifying a patient's root cause of a disease. The last session of the workshop by Dr. Niveta on elemental diagnosis. She explained about 5 elemental theories and how imbalances in these elements leads to diseases. So as an overall workshop has emphasized, the diagnostic process should flow from an extensive case history and physical examination to a differential diagnosis that lists possible alternatives for the presentations within the patient. So names of the colleges and institute participated in the workshop. STM College of Naturopathy and Yogic Sciences, Ujire. Alvas College of Naturopathy and Yogic Sciences, Mudbidri. S. Vyasa, Bangalore. Sant Hidram Medical College of Naturopathy and Yogic Sciences, Madhya Pradesh. Dr. Roshita's Women's Health Clinic, Kasargod. S. Tangapadam Medical College of Naturopathy and Yogic Sciences and Research Center, Tamil Nadu. PSTR Krishnamal College for Women, Tamil Nadu, Yoga Ayush Naturopathy and Yoga Clinic, Ranibagh, Delhi, Morarchi Desai Institute of Naturopathy and Yogic Sciences, Gujarat. So we sincerely appreciate your presence in this workshop and active participation in the workshop. Thank you.
Thank you, ma'am. I request any one of the undergraduate students to share the feedback on our workshop.
Good afternoon all. I'm Abhinaya from S. Vyasa University. So firstly I would like to thank Enopoya University and NIN for organizing this workshop on naturopathy diagnosis. And I would like to thank all the doctors who shared their experience and knowledge which is really useful to us. And we are also like wonder that they are actually practicing it and sharing the knowledge to us. And as interns, we found it useful and which will be useful in our future clinical practice and make our clinical practice more unique way. And it's we can add in our case sheet also, and the diagnosis part of completely naturopathic setup. And I would like to thank all the committees in transport, food, stay, who gave and helped us in all the ways. And thank you, sir.
Thank you, Abhinaya. Now I request one of the postgraduate students to share the feedback about our workshop.
Good afternoon, everyone. The workshop was really good, very well organized, and I found the emphasis on naturopathic diagnosis being given properly here. And as a postgraduate, I found this very informative, and many other things which I didn't know, which were very new to me, I learned here. And with regards to the sessions, all sessions were very good. We started from the basic concepts, from health, definition of health, to vitality, to the diagnosis of iris diagnosis, then elemental diagnosis. All was very good. I hope we will get more such sessions to attend, and thank you all for this interactive, making this session very interactive. And yes, sir, thank you.
Thank you, Vishwish. Today we have Dr. Ravi Vaswani as a guest of honor, so I request Shreya Patil to give a brief introduction.
Dr. Ravi Vaswani works as a professor in the Department of Internal Medicine at Enopoya Medical College in Mangalore since 21 years. He was the founder register of Enopoya deemed to be university in 2008. Dr. Vaswani completed his MBBS from Nair Hospital, Mumbai in 1986 and MD Medicine from KLA University, Belgaum in 1996. He has a special interest in the infectious disease with a personal focus on HIV medicine and COVID-19. He has clinical and teaching experience of more than 22 decades. Behind his clinical works, Dr. Ravi Vaswani is also trained in the teaches bioethics, research ethics and clinical ethics. He is the Joint Secretary of Enopoya Ethic Committee. Now, I would like to ask Sir to address the gathering.
Good afternoon, namaste and assalamu alaikum. May the blessings of the holy month of Ramzan be on all of you all. Respected dignitaries on the dais, Dr. Madan Kumar, Dr. Puneet, respected dignitaries and teachers of the dais, students, I would like to take this opportunity to thank the organizers for giving me this opportunity to be here with you all for a few minutes and share just some few not very naturopathy but definitely important and related to how we should practice any healthcare related profession. So I would like to talk to us here about what should be the attributes of a good clinician. How should one be a successful and more importantly a meaningfully good clinician? So I'm not going to cover all the points, but I would think what are important to me, what attributes I think are important. One of the most important attributes that comes to mind is listening. Listening is different from hearing. Hearing is the physical disturbance of airwaves that produces sound in the ear. Everybody hears, but very few people listen. To be a good doctor, one has to be what is called as an active listener. So we need to do what is called active listening, because active listening is an extremely important tool or skill that a good clinician must have. I often tell my students, listen to your patient. He's telling you his story, and that's why we call it history, because it is his story. And if you're listening carefully, the patient will be telling you the diagnosis, but we've forgotten the art of active listening, and our mind is jumping ahead to writing down investigation and sending the patient away for investigations. We become very less attentive to the needs of our patients. I'm saying this from the experience of my 25 years in teaching. I'm sure you would have all experienced, or at least a teacher would experience this in your field as well, but definitely in the modern allopathic medicine, we become less and less hearers and listeners, which we need to change. The other important attribute is to observe, not just to see, but observe. Seeing is the act of light falling on the eyes and stimulating the retina, but observing is our mind registering it and making sense out of it. So we don't simply need to see, but we need to observe. One of the few things that were taught to us right in the beginning when I was a MBBS student, and I had just come to my first ward posting, I was in the third term, and we were told you must observe everything. The smallest details should be observed. How does a nurse make the bed for the patient? How does a nurse cut the nails of the patient? Are equally important as how a doctor auscultates or palpates or does whatever he needs to do. So we were taught the art of observing even the smallest details in the wards. And that is an extremely important attribute that one should have, the skill of observation. There is an old joke in medical colleges that go around, and my father told me this when I was a small boy, because he was a student of King George Medical College, Lucknow, many years back. He said when they went for their first clinical ward posting, the teacher had this batch of students around him, and he told them that it's very important to be keen observers. And he said, here is a jar of urine from the patient who has diabetes, and diabetes, is excessive sugar from the body flows out in the urine, and therefore we can taste the urine to make out whether the patient is diabetic or not. And he went, pretended to taste it, and he passed the jug around to everybody, to all the students, and all the students started vomiting and feeling some funny sensation. And then finally he told them, look, I dipped my ring finger inside and sucked my middle finger, and you didn't observe this difference. So observation is an extremely important skill that all healthcare professionals need to develop, and it comes over a period of time. It comes with repeatedly observing, and as you all have learned recently just now, you can learn by observing different parts of the face and picking up the ills in the body. And I'm sure that's an extremely important skill that you all in naturopathy need to know. So I would say that observation is an even more important skill in you all than it is probably in modern medicine. The third attribute is to feel and not touch. Touching is just the act of physically getting the nerves stimulated with some sensation. But perceiving that touch as to what it means is feeling. So we need to feel, not touch. We need to observe, not see. And we need to listen, not hear. So we need to take everything up one level higher so that we become better clinicians. We all need to know that as doctors, we may be considered cream of society, but we are still human beings. And we need to know our limitations. We need to know that this is how much I can do, and beyond this, I need to send this person somewhere else, or tell him that I cannot handle this and he needs a different level of care. So that's a very important statement. And in my textbook of medicine, which is called Harrison's Textbook of Medicine, when you open up to the first page is completely blank, and small lettering in the middle, there's just one sentence which is written there. It says, "Physician, know thy limitation." And it's an extremely important lesson that my book was teaching me, because sometimes we tend to forget what our limitations are, and we'll end up creating trouble for ourselves. As physicians, we need to be truthful, and that is the one thing we are not. I tell my students, often in my bedside clinics, I talk to them, I say, doctors are habitual liars. From the moment we became doctors, we constantly lie to our patients at all times for various reasons. We may be wanting to give false hope to the patient, in which case we are lying. We may not want to hurt the patient, and therefore we may lie. Very often we don't want to tell the diagnosis because the diagnosis contains bad news, and we feel that the patient may die of shock, and therefore we will not tell the patient the truth. So we are often, more often than not, we are telling lies than telling the truth. But we need to change. We need to be truthful. So telling the truth doesn't mean breaking it in such a way that the patient really dies of shock. So we need to break it in a way that is gentle. So we say doctor-patient relationship starts from the moment the patient walks into the doctor's clinic. Now that is the first point of contact where a doctor has an opportunity to assess his patient, to see what is the personality of my patient. So his illness is at one level, but his personality is at a different level, because based on his personality, you will be able to guess how much of the truth he really wants to know. Repeatedly they will come back to you, sometimes with some investigation reports. You might have asked him to go get some tests and he'll come back. So you'll get 3 or 4 occasions where you'll be able to interact with this patient, and at each interaction you will go on adding to your assessment about his mental abilities and capabilities. So each patient is a different person, and each patient you will need to give them truth in a different way. Some people may be very strong mentally, and you can say, okay, you have a cancer, you're going to die in 6 months, and that may be fine. Some people may be very weak mentally or in personality wise. We need to break it more gently. Sometimes the patient may not directly himself want to know, so doctor needs to assess from the patient in the first meeting that who do you want to be along with you when we are sharing the news about what you have. And he may say, tell my wife, tell my brother, don't tell me, or some such thing. So then you will get an idea how much we can tell to the patient and over how much period of time, and how to break it gently so that we can convey the truth without hurting the patient. Of course, there has to be a fine balance between these two. So I always try to speak the truth to my patients, and I've always tried to keep this habit. I'll give you 2 examples of the extremes that happened in my truth telling. The first was a case in Belgaum where I was practicing. An army officer's wife, a young lady around 40, came to my clinic, history of headache. I checked her blood pressure, it was high. I said, look, this is the first time I'm seeing you. So maybe you were tense and your blood pressure went high because you were seeing me for the first time. You have high BP, but I don't know whether it's really high or not. We'll wait, we'll repeat the blood pressure once again after 3-4 days, and then we will know whether you really have high BP or not. Half an hour later, after she goes home, the army officer calls me and starts shouting at me on the phone. What did you tell my wife? Ever since she has come home, she's only crying, not talking, not eating, not doing anything. So she went into depression knowing that she had high BP, which she didn't. And I was just trying to tell her that maybe you don't. Eventually it came out that she did have high BP, but at that point of time I didn't know. So I told her the truth, and she got very badly affected by it. On the other extreme, I came here in 2003. In 2004, I had a patient from Kasaragod, a Malayali speaking patient. I am a Sindhi from North India. I have come to Karnataka for last 30-35 years. I speak Kannada. I also learned a little bit of Tulu, but I don't know Malayalam. Now this patient of mine had a cancer in the lung. The cancer had spread to different parts of the body. It was inoperable. Patient was in his last stages. So I told my postgraduate student who speaks Malayalam, saying, please tell him that he has this cancer which is in the last stage and we can't do anything for him. He can just go home and take rest for whatever number of days he's going to live. As the PG was about to tell this to the patient's wife came and said, please don't tell my husband, he will die of shock. So the PG was very happy that he didn't have to be in a bad, difficult situation, and he ran away from there saying, I'm very happy that you said this, take your patient and go home. Patient got discharged, went home. Got some cough, cold, fever in Kasaragod, went to his local doctor. When the doctor saw him, looked at my discharge card and said, bronchogenic carcinoma. So he wrote a referral letter to Regional Cancer Center Trivandrum and sent the patient from Kasaragod all the way to Trivandrum. Patient goes to Trivandrum and sees this big board in Malayalam which says Regional Cancer Center Trivandrum. The first time in his life he came to know, am I having cancer? That's why doctor sent me here. He goes in, the doctor confirms his worst fears, and then he asks the doctor, doctor, when did this cancer get known? And that doctor in Trivandrum showed him my discharge card saying, this is when you were in Yenapoya. So he comes back to Kasaragod, recovers from his illness, waits for a day, calls him the hospital. When is Dr. Ravi Vaswani's admission day? He said Tuesday. He catches a train, comes to Yenapoya, gets admitted. Next morning in the ward in front of the nursing station, he catches me and he is blasting me with 500 words a minute of Malayalam. I don't understand a word of what he is saying, but his facial expressions are very clear. Doctor, you betrayed my trust, is what he is trying to say repeatedly. I'm just standing there listening, these waves of tsunami going all over me. I have to accept that whatever I did was wrong. Then after he went away, I asked my PG, tell me what he said. And the PG told me, sir, this is what he said. Then I said, did I not tell you to tell him? Why did you not tell him? He said, sir, the wife told me that he will die of shock. So I said, very good, I didn't tell him. But where is he died of shock? I said, he's killing me of shock. So there are two extremes of truth telling. And we don't know what each patient is going to like. So it's not a one shoe size that's going to fit everybody. We need to be a different approach with different people at all times. So that will come only with experience. As you start practicing and seeing more and more patients, you will know that there are different types of people in this world and each of them needs a different approach. You must all be lifelong learners. So don't stop learning, and I'm very happy that Yenapoya Yogic Science and Naturopathy College has organized this workshop in collaboration with Dr. Madan Kumar's institution, the National Institute of Naturopathy, and this is giving you an opportunity for lifelong learning for postgraduates, for teachers, for everybody. And I think this kind of workshop should happen much more often, and I wish that you all will carry up this good, continue lighting the torch and spreading the light of knowledge to everybody. Thank you very much.
Thank you for your valuable words, sir. Now we have Dr. Madan Kumar as a guest of today's valedictory function. I request Farhana Rafiq to give a brief introduction about the sir.
Dr. S. Madan Kumar is working as a domain expert yoga. He has specialization in the field of naturopathy and yoga. Dr. S. Madan Kumar completed his BNYS from JSS Institute of Naturopathy and Yogic Sciences, Coimbatore, Tamil Nadu in 2009. Additionally, MBA from Alagappa University, Karaikudi, Tamil Nadu in 2011. MSc from University of Madras, Chennai in 2013 and completed MD in Naturopathy and Yoga from Government Yoga and Naturopathy Medical College and Hospital, Chennai. He has fellowship in Gandhian Studies from National Institute of Naturopathy, Pune in 2018 and currently pursuing PhD Yoga from Meenakshi Academy of Higher Education and Research Center. He worked as a lecturer cum medical officer in ALN Rao Memorial Ayurvedic Medical College, Koppa. Currently, he is a domain expert in National Institute of Naturopathy, Pune. He received Best Research Paper Presenter Award in the Simmerdgan 2018 Second International Conference on Stress, Yoga, Mind-Body Medicine organized by Sri Ramachandra Medical College and Research Institute, Chennai, Tamil Nadu. Now I request Sir to share his experience about the workshop. Over to you, sir.
Warm good evening to all. Good evening. So, on behalf of National Institute of Naturopathy, I thank you all. First of all, the participants who are all assembled here, because this I can say this workshop is a great success. First of all, why? Because of not because of the patients listening. It is the attendance. Both the days attendance remains same, not with much absenteeism. And we had given the permission of 100 seats, and maximum it was occupied, even it was in the waiting list, and the presence of the participants also full. And first of all, for that only I thank you all, and this is a great success. And coming back to Yenapoya, it is one of the first time I am visiting, sir. So it's a remarkable experience here. Before I was working in Tamil Nadu, that time I heard, that time it was different principal was there working here. That time itself I have an idea to meet here, because it has one of the premier institution having this anatomic table and all, which we were thought to procure. Throughout India, only 4 institutes has that table and all. This Yenapoya is one among them. It costs more than even 2 crores, I hope so. Even I had a thought to have a visit, not able to, because they have some other programs with that. So such a premier institute they are having, and the students of Yenapoya, not only BNYS, all the students of various domains are blessed to have such facilities here. And coming back to this program, maybe you people may know or may not, this is in collaboration with NIN and Yenapoya. It was conducted, but the expert or the topics were not decided majorly by NIN. It is decided or even given with the proposal from the Yenapoya BNYS college only, from the principal desk only. So as soon as the topics were seen, it was so highly, and to be frank, this is the very first time from NIN on this topic, that is Prakruthi Vijnana, we are conducting a workshop. Till now, more than 30 years of working lifespan of NIN, this is the first time we are conducting such a workshop in such a topic. So it is a different topic by the name itself, and the various topics what they propose. Madam immediately said we can go ahead. To be frank, this is the financial year end of NIN, March. So all the funding things were exhausted. But then also by attraction of this topic and the usefulness of this topic to the students and the doctors community, Madam gave the direct approval. We can fund somehow through all the workshop we exhausted for this academic year. Whether we can go for any CME or workshop, that funding will include this, and we can conduct the program. So by that only it initiated, and it went on well also, and hope these topics enlightened you people. It is not that these topics or these particular speakers are going to end over here, or it is in the live YouTube live of Yenapoya University, it is there. It is the success of this is going to be where you are going to serve the community with based on these diagnostic tools. Each topic is we can say it is a diamond in our naturopathy field. Each one of them are flourishing really, whether it start from facial diagnosis or pulse diagnosis, or we can say tongue diagnosis or iridology diagnosis. Each one of them are a benchmark in our department, in our field, naturopathy field. Such as speakers, they were selected and they were brought here from various states of the country, and they delivered here, all because only thing is it is not by NIN or it is not by Yenapoya. It is for the students and for the community of ourselves. So when this success will come or the fruit will come is like when you are taking these things and practically applying. So 3 things we can have after BNYS. One is you can be a good clinician. So clinically you can flourish. Second thing is an academician. Academically you can flourish. And third thing will be a good researcher. So I can say you can implement these all things when you are having this. So if you are a good clinician, you can say the same thing to the students. And with the help of the students and yourself, you can be a good researcher also. It is not that you can be only one person. You can combine all these three things also, and you can flourish. So make use of the points, what all they said here in the last 2 days. We will be in communication with you. They have all the contacts. You can ask them also, the coordinators, and you can take use of each one of them at any point of time. And coming back to Sir, Dr. Puneet Raghavendra Sir, it is really a good, remarkable session, and it is the first of its kind in Yenapoya under his tenure. He is conducting this workshop in collaboration with NIN, and I can say happily, sir, that your team is a good team. I mean, remember few names like Ajit, Madam and all. She used to contact me, not contacting. She used to press me to get all the details by the midnight 11 o'clock. Even I remember 11:55 she messages me. So she sees my WhatsApp, sir is online, so we can. So that way she presses me and get all the information of the speaker, their contact number, their CV, photos, what all here. So they all utilized it very perfectly, projected it very perfectly, and the coordination and the work of the force you have is you are having a blessed team under you. So that is the real success of that becomes the real success of this program, and we are going to collaborate again with NIN. Already ma'am promised in our inaugural talk also. So forthcoming we are going to have so many sessions like this on different domains, and you are welcome to NIN. For not only Yenapoya, welcome to NIN also. In NIN we have several skill development courses. Maybe you people know, may not know. We have several fellowship courses, fellowship on basic and advanced acupuncture we have, which is of 6 months tenure, and where you will be having a detailed session what you had yesterday. And we have fellowship course in research methodology we have, that also you can utilize if you are highly interested in research. And we also have fellowship course in Gandhian studies. So Gandhian studies also we have, and we have fellowship course on even ozone medicine also we have. So if you want to flourish in ozone medicine, that also you can utilize. These all things are there in the NIN website. We are going to collaborate on these domains with Yenapoya also very shortly. And regarding that magazine subscription form we gave, so the magazine is also circulated to you people. On a last note, I want to say that only. In that, if you gone through, there are several articles, both in Hindi as well as English. If you are good in writing, you can send your articles, whichever article. It might be clinical oriented, it might be research oriented, it might be academic oriented. Whichever article, if you like, you can write. Either it might be 500 words or more than 1,500 words. It will be, if the article is very genuine, without any plagiarism, it will be published in any month very shortly as soon as you are submitting. So that article will be published. It is a national magazine, so throughout India they will be reading your article with your name and with the particular domain where you are working. And for that, the honorarium also will be provided 500 to 1,500 rupees. So make use of the opportunity, and you can write articles also on that. Because most of you people are very good in English, most of you have the good knowledge in writing, so make use of the opportunity. Your name will be coming in the national magazine of us. Okay. And last, thank you once again Yenapoya for organizing such a wonderful workshop on Prakruthi Vijnana, and thank NIN also for making me as a coordinator for this program. Thank you.
Thank you, sir, for sharing your experience. Now I request the president of today's valedictory function, Dr. Puneet Raghavendra, for the presidential address.
Very good evening to all. Dear Ravi sir, my guru, because recently I joined to the course PGDB EME in Yenapoya University. It's a PG diploma in the bioethics and the medical ethics. We are running that program here since 2-3 years before. There is a 1-year course duration. We'll have the 15 days of the orientation program. So post-graduation, you can plan for that also from the next year. PG diploma in the bioethics and the medical ethics. So the sir was my teacher in that. So the day we had the discussions along with him, so I thought a few of the knowledge what he has been shared, it should be shared along with our students also. Because once I read the book on Dr. B.M. Hegde about what we do not study in the college especially. So that's what comes only from the experiences. So that's the reason he has come all the way here. So thank you, sir. And also Madan, we are in contact almost since 2017-18 onwards. He was there in Bhopal, he and the Kalpana. So we all are the academicians only at that time. Since we are in contact. So we found very happy for you to be here. And regarding the workshop, so the plan has been started from May 6th of 2023. We had one Sutra Vijnana, one day CME. So it was on the very good success, and we had the issues of the accommodations and all issue. That was with the hesitation, we had the one day CME. So after that, next day, anyhow, we have the academician, means there's only the one thing will be the head. Whatever the new kinds of the innovative teaching techniques we can give to the students so that they will learn in detail. So I had a discussions with my colleague, Dr. Sunita. Sunita, can't we done it on the diagnostics on the next part? Because when you look into the, among our BNYS communities, there are the maximum kinds of the conferences what we conduct, they will be related to the yoga itself most of the time. Other than the Naturopathy Day, only the one conferences will happen in the nationwide, or else all will be towards to the yoga conferences. But the funny part of that, how many people will be registered? Out of that registered, hardly 10% will be the inside, and the 2% may be the our media people will only be there inside there. The students will be all around roaming. So we thought we don't want to happen such an kind of the conferences. We can plan it on the workshop so that we'll have the hands-on training. So we started with the plans of this year. Once again, my team, my backbone, they are completely ready. So we planned with the self-funded projects only we can start it, because university was giving the minimal up to the 30,000 was the fixed amount. So beyond that we can take it from the registration fees and all we planned. Then suddenly I also had one discussions with the Satyanath sir. It was discussions was happening since September of the 2023. So this is our project, we want to plan it on the next time, shall we have it? And he said, yes, that's very good, Puneet, we can go ahead. Because they seem to the more into the academics, not into the clinical oriented. I mean, to the it may be the case presentation that kinds of will not have, or it's not in the disease oriented. Sorry, it's not into the disease oriented. This is into the academics oriented. So he said, "Oh, yes, okay, we can go ahead." So this is how we came it to the month of January only. We have been planned, and we were planning to have it from the April onwards. But as a financial year ends at the March, we have to plan it at this moment, before end of the March. Okay. So we started that. The beauty of this program is I have written the mail on the one Monday morning, and the Tuesday afternoon approval was on my table. That was a fast and furious of the NIN. I have to thankful for them regarding this. With the fund sanctioned, everything it was there, and we were the limited peoples of the 100 people. The reasons for this 100 people limitation, it is a hands-on training on the workshop. If we go beyond that of the 100, the training will be quite difficult. So that's the reason we have limited into the 100. Okay, we started with the registration now. When we entered into the registration, I have to share the beauty of this registration, because till in my life we have never come across this kind of the registration. Because what happens in BNYS community, so if we announce any kinds of the workshop or the conferences, the first they will see that who is organizing. Okay, whether it's NIN is organizing, plus along with the CCRN, Central Council Research in Yoga and Naturopathy, are they organizing in that? Okay, fine. If they are organizing, then the next they will see that, where the TADA will be provided to travel. If the TADA will be there, they will register. If not, it will not be registered. So that's what happens. So we had to come out of that to bring that changes. So we made into the started with the registrations. So in this registration, we placed with the, I can say the date also, exactly on the 14th of the February morning, 6:30, I placed the mail. There's also only the WhatsApp, not even any mail to the any other colleges. Only the WhatsApp message I shared at the morning 6:30, and afternoon 3:30 we had 75 registration out of 100. Okay, still the date continued on to the next day. The registration was hurry-burry. I have spoken to the few of the colleges also personally, and a few colleges they said, generally we will think at the end, last time they will give a call, the seats has been not filled, come and register. So that's the reason we were waiting. It has been not happened. The next day, by afternoon 12:30, 1 o'clock something, it was rushing there. The registration was keep on happening. The Google form, it was a filling. Then we had to stop it for the 100. So we stopped Google form exactly by the 3 o'clock. Still the registration was happening continuous, but what we made the mistake, the payment was happening there. When they were about to submit, Google form was closed. And they were calling all the ways. The same day anything happened, there was a contact given my number. Same day afternoon, my SIM was dead. And no one able to contact me. Okay, so then we spoke with the accounts department. Immediately they stopped the registration. They said already the registration has been stopped. We have, so where we can take up to the 100 people, there is 130 we have been registered now. Fine. Then I spoke with the NIN. They said, Puneet, you don't need to change it because what happens any kind of the NN workshop, what we have been observed, even though in spite of 100 registration, end of the sessions, then the 30% will be the withdraw. So better you keep it so that you may keep it in the waiting list. Now is our challenge, how to consider the 100th person registration, 100th and the 101. Okay, we went back to the accounts department about the payment timings we had to consider. Okay, so we took it from the payment time. The 100 person had the payment by 3 o'clock, 15th minute, 02 second. And 101 had 3 minute, 3 o'clock, 15th minute and the 6th second. 4 second was the difference among these two. Okay, so that's the reason we had to keep all the other peoples in the waiting list. That's how we have been made, and still after this closing of the registration, furthermore the call was keep on coming, and we asked with the NIN also, can we increase the seat? They said no, we have taken the approval on the 100 only, we cannot increase. As the Madan mentioned, it's all the projects has been closed, but looking into the uniqueness of this workshop, it has been sanctioned at last. So that's the reason we had to limit it to the 100. So again calls were started to come from all the other colleges, nearby colleges. I started given the first reason, there is no chair, there is limit for only 100. They said we'll bring the chair also. Last day one boy he has given from the college call from Bangalore, he said, sir, I want to register. I said registration is closed. The certificate cannot be given. We have printed only the 100 certificate because there's a registration number. Even we were unaware about that. So I discussed with the NIN. They said, see, we are framing from the 100 people. That's a registered people only. We cannot give the 101. That's the reason certification also should have the numbers. So that's the reason we had to go. That's the reason we were not able to go for the online registrations also separate. Online media too. Like in Google Meet also we could have been not shared. That's not announced. So that's went to the 100. So I told this guy, no dear, there is only the registration has been closed, the certificates we cannot give. He said, sir, I don't want the certification. And then he said, no dear, I cannot give the accommodation. So I'll book the room in the outside. And I said, the food sanction for 100 people, dear, I cannot manage. So I'll go and eat in canteen only in the outside. So this was the uniqueness we have been brought this time. It's not because of the minimal registration, because students had the 250 rupees registration, sir, and the doctors had the 500 rupees registration. It was not the huge amount of the registration, but because of the uniqueness where we learn in the college, pulse diagnosis a part, facial diagnosis a part, as well the tongue diagnosis as a part, but we will not get the hands-on training there. And it will become a kind of the mass kinds of the studies. So that's how we have been changed that scenario. And in the future, if any of your colleges, if you can take over this same project, we are ready to help it on that. Because when we had the discussion, other colleges, they said, well, you want to give it to the other colleges, you can conduct it on the next year also, no? I said, no, it is nothing like the copyrighted, so that students from the other colleges also will get benefited, because if the registration was kept open, the number would have been crossed 500 plus this year. But there is a reason we have to fix it only to the 100 that we have been stopped. Anyhow, options are to open, and now the team is ready with us to speak about the various subjects. So any colleges, if they are openly, freely, and you can, anyhow, Madan is there, through him you can approach to the NIN also. For the next years, you can go for these plans. Okay, we will be helping on that. So with this, I hope most of you have updated your knowledge. Those are the completed course and my students. I'm very happy to say, out of this 100%, above 50% are my own past student, current students and all the way from Alvas, SVSA, which and all institutes have been worked, they have been come along here. So very happy to see you all. And special thing, I have to take this opportunity to take my team, to thank my team. I think if my team would have been not there, the success would have been not happen. You would have been observed in the many other conferences, like if you call for any accommodation and the transport, usually they will not pick the call at last. Correct? But it has been never happened in this small workshop, even though we have the smaller team of 6 to 8 people. So everyone has been worked, that is beyond their time schedule. Last day I was just checking on Sunday evening, Sunday late night, we dropped the guest to the director has been come. I dropped her to the Niyasha. I reached back to the home. I'm just seeing the messages of Ajit has been written the bus numbers. Right? Bus numbers in the group, which and all bus cities has been coming is through there. And that time I thought, so what is the commitment my team has on that? So I should thankful for that. And regarding the stage program, as Madan sir said, Padma is very perfect she will be prepared within 2 days before itself, because at that moment she should not get any confused. That is the reason. Will not be biased. That's the reason. That's how they have been worked. Especially I can say, even though I will be negotiating sometimes, they'll comment, sir, amele problem agbardu. Heli sir, we'll make it right now itself. Anta. Okay. So this is what the whole team effort. And last but not the least, I want to thank all the delegates, those who have participated here. As Madan said, no one is roaming outside. Correct? No one were roaming outside. All were attended here. And the much more point I have to observe, no one were using much of the mobiles here. This is one thing I have been observed in this time. See, what happens if any workshop, any CMEs and all, or the conferences are there, more people will be keep on using the mobiles. Correct? But among the most of our students have been never observed. Even though you had an opportunity, but the mobile wasn't kept on, you'll be most of them making the notes. There are the few discussions were happening one another. It may be about the point what you have been received, what you have been heard. So this and all a very good, that's what you have spent your valuable 2 days. I hope we have not wasted these 2 days, right? So with this, wish you all the best and have a great time. Thank you.
Thank you, sir. Last but not the least, Thanksgiving is a time of togetherness and gratitude. So I request Dr. Abhijna, Assistant Professor, Department of Clinical Naturopathy, to propose a vote of thanks.
Good evening, everyone. It gives me immense pleasure to propose vote of thanks on behalf of Enapoya Naturopathy and Yogic Science College and Hospital, Enapoya deemed to be University, and National Institute of Naturopathy, Pune. First and foremost, I would like to extend my heartfelt gratitude to our Chancellor, Pro-Chancellor, Vice-Chancellor and Registrar, Enapoya deemed to be University, in their absence for their constant support. I also extend my gratitude to the Director and Organizing Committee of NIN Pune. Now I extend my heartfelt gratitude to the guest of honor of today's valedictory function, Dr. Ravi Vaswani, Professor, Department of Internal Medicine, Enapoya Medical College. I request Dr. Puneet Raghavendra to present the token of gratitude. I would also like to thank today's guest, Dr. Madan Kumar S., a domain expert Yoga NIN Pune, for his presence and support in organizing the workshop. I request Mr. Ajit to hand over the token of gratitude to Sir. My special thanks to the president of today's valedictory function and organizing chairperson of this workshop, our beloved principal, Dr. Puneet Raghavendra, for his constant support and motivation throughout. I express my sincere gratitude to the Enapoya Dental College for providing this beautiful venue. Now I would like to thank our organizing committee, the main driving force for their tireless efforts over the workshop. Dr. Kajal Gupta, Medical Officer NIN Pune, Registration Committee, Dr. Sunita, Dr. Shreya, Dr. Ashad and team, Stage Committee, Dr. Padma Shri, Dr. Shagupta, Dr. Abhigna and team, Food Accommodation and Transportation Committee, Mr. Ajit, Dr. Arpit and team. Also special thanks to all the teaching and non-teaching faculties of YNYSCH and students of 3rd year BNYS for their dedication. I would also thank our distinguished speakers for sharing their expertise. Here I extend the gratitude to the IT department, maintenance, food and transportation department. Last but not the least, I extend my heartfelt gratitude to each of you for making this national level workshop on Prakruthi Vijnana a resounding success. Your active participation and insightful contribution and enthusiasm has truly enriched this event. Thank you one and all. Thank you. I would also like to thank our photographer. Thank you.
Thank you, ma'am. Now I request everyone to stand for the national anthem. I request all the delegates to be seated here. Don't move, please. Third year BNYS, please stay back. Everyone.
Dear all the delegates, now we have one demo session on chiropractic, only on 2-3 subjects, okay? Anybody having neck pain or back pain, so you can come as a demo. Come. Yes.
See, I know everyone wants it, but basically I want 3 or 4 subjects with a neck pain, back pain. Rest of the cases, see why I can take many more, but without seeing your X-ray, without knowing your body properly, I don't want to do any problem here. Okay, so that's the reason. 3 or 4 you come, I'll just touch, I know, I'll examine the spine and then start off. So maybe any of you 2 ladies also can come. Yeah, 2 gents are there.
Yes.
Okay. Yeah, can I have your attention? Now you see, when I said 4 only, you see my clients here. Okay, that is the demand what you can have if you say I am specialist in pain management tomorrow. Right? So, believe me, I am just taking 2 more minutes. BNYS means you are sitting in a gold mine. It's in your hand how much you want to dig and extract gold. So there's no dearth of money, there are no dearth of opportunities. At least when we studied, we never had any jobs, we never had any much of an employment opportunities, but we created many opportunities. Like being a student itself, by the time I came to final year, I was a consultant for more than 12 companies in Hyderabad, where I was taking care of the entire company's staff health as a health consultant. Okay, I did more than 30 workshops by then for